Hello. I'm seeing only one hello here. What's up? Hey, everybody. Please tell the people that are not here that I'll give them 5 minutes. 911 already. Ha. I don't understand you and this. You and 911. What is happening? 911 so early. Please tell them I'm giving them 5 minutes, all right? Three minutes. One minute to go. Hello. How are you doing? Hold on, I'm trying to. Okay. Okay, we are 26 already. That's good. Hello. Good evening. Yes, all is well. I'm fine. Yes, I'm here. He said, who are all these people? You're very funny. Alison, I see you. Okay. I don't know if I've had life with any of you before, but there is rules and regulations to whatever we are doing here. All right. Number one rule is that everybody has to participate. All right. Not from our class. Everybody has to participate. You have to focus, you have to participate. There will be definitely a lot of people, but if there are 20 people here, make sure that you are participating. All right. There is a number of people that we make the same response, and I will proceed. Even if the answer, the same, you are giving the same answer. All right. Still give me that answer. Still write it. Don't fold your hand and say, okay, oh, people, somebody has answered the right answer, or a lot of people have answered it. No. The more comments I see, the more energized I am to proceed with this discourse. And also, I want you to see this thing as if you are preparing for your exam, as if you are taking your exam right now. So I don't need you on your screen. 911, please hold on. I don't need it on your screen. Your what am I saying? Your lecture slide. No, I don't need your lecture slide right now. So I need you to attempt these questions by heart, as if you are inside the exam hall. Because you are in the exam hall, you won't be opportune to use your slides. You are not able to use AI or Google it. No. So just the way you'll be in the hall, that's the way I want you to answer these questions. All right. Even if you get it wrong, that's fine. Then you get the right answer. And if you have any problem, even if you don't know the answer, please write 911. Somebody's already writing 911. Write 911 or emergency. Then I'll be able to make some explanations. All right. Very important that all of us follow the rule. So since we are 30 something here, if I put a question, at least I want 20 people to attempt that question. Even if it's the same answer, that's fine. Hey, Jesus. What's up? Okay, what is the problem? Empress. So you can always write anything for me there and I will respond to it. All right. So today we are supposed to discuss some very interesting topics. As I said, this is not teaching class. This is like review. Send me email. So as I said, we there are a lot of chapters that you are supposed to know by now that I'm supposed to review with you. That's chapter 17, endocrine system, circulatory system, blood, the circulatory system, heart, blood vessels and circulation, the lymphoid and immune system, urinary system, and respiratory system. Respiratory system is very important. Despite the fact that I've not really taken it in class with some of you that happen to be my students, it's extremely important that you go and study it. All right. So I'll try for people that are writing my exam. Personally, you'll be writing on the urinary system, lymphoid and immune systems, blood vessels, and circulation. That's what you'll be writing for my exam. Now, for the midterm, you'll be writing, oh Jesus, you'll be writing from endocrine system, that's chapter 17, to chapter 23. You understand? So it's the same thing, both the exam and the midterm. The only difference with the midterm is that the midterm has another 3 to 4 chapters added to the exam we are going to do this week. I hope you understand. I explained all these concepts in class. So today I want to focus more on the exam we are going to have this week, which is the urinary system, immune system, and blood vessel and circulation. So we focus on it. We prepare for it. It's the same question that you still see in your midterm. So before your midterm, the upper week, we will still get a review class to review the remaining chapters. Does that make sense? If you understand what I say, I want you to write yes on the comment section. Let me see how many people that understand what I'm saying. I'm saying we're okay. Let me see how many yes I get. Let me see if I can get up to 10 yes. 1, 2, 3, 4, 5, 6, 7, 8, 9. One more person, 10. Okay, so that makes sense. So today we are going to move backwards from urinary system, lymphoid system, and blood. The faster you go, the better we are able to accomplish these things. All right? The faster, the better. Okay? So, please, you don't need to use your lecture slides to check if you are correct or not. No. Make that mistake here and now. Please. See yourself as if you're writing the exam. The only thing I just need with you now, right now, is just you sitting in front of your screen and put your hand like this, ready to type the answer. A, B, C, D, E. All right? Okay. I'll be posting the question in the box. So pay more than usual attention. Fast and furious. All right. So let's start with urinary system. So because your exam is both multiple choice and true and false, I'm going to put, normally I don't put true and false in my reviews. Or let's start with true and false for urinary system. Let me give you only true and false first. I have about 15 of them. I'll give you true and false. And after, I'll go to the multiple choice question. So any question I post now, you tell me true or false for that question. Very fast. And if it's a question that you don't understand, if there's a few people that don't understand it, then I can explain. Okay? So, yes. I usually don't give true or false questions, but just because your midterm, we have true and false, I'm going to put it here because I really want to make you very equipped for that midterm. Do you understand? Okay. So let's go. Very fast. Okay. The spirit has spoken. Exactly. And also, for people that are writing my exam will be 75 questions. The spirit has finalized that deal. And your midterm is also 75 questions. So you have to take it very serious. Okay. So let's start with this, guys. The most toxic of our metabolic waste are nitrogenous wastes. True or false? Very fast. I need us to be extremely fast. If up to 15 people gives me the answer correct, I move. I give you the answer and I move. Thank God. Quickly, guys. Quickly, guys. Oh, somebody's just coming now. Yes, you will. Okay, let's see. True. Yes, the answer is true. You understand? The most toxic of the metabolic waste are nitrogenous waste. Remember what I told you about nitrogenous waste. Remember what I told you about BUN. All right. Remember what I told you about when the BUN quantity is too much. You remember azotemia? Remember the characteristics of azotemia. These are sub questions that definitely will be coming up. A bit slowly? No, I won't be slow. That's why I'm using YouTube, so that if I am too fast, that's fine. You can always go back to the live, click the live, and any part, any question you miss, right? You slow it down and listen. All right. Because if it's slow, we will not be able to finish. There are a lot of questions I need us to discuss. All right. Thank you. So look at this question, guys. Tell me if it is true or false. Quickly. Quickly, guys. Stimulation of sympathetic fibers of the renal plexus increases blood flow. True or false? Quickly, my people. Quickly, quickly, quickly. Stimulation of the sympathetic fibers of the renal plexus increases blood flow. Good. The answer is false. I told you, sympathetic. Sympathetic. It actually decreases renal blood flow rather than increasing it. Right? You remember when I told you about vasoconstriction? It constricts the stuff. You understand? That because blood is being diverted instead of going to the kidney, GFR slows down. Instead of going to the kidney, it's going to the other parts of the body that needs that blood at that moment to speed up. It's just like when you are running. When you are running, you don't feel like pooing or peeing. You see? You don't feel like pooing or peeing. So sympathetic, you don't feel like pooing or peeing because blood decreases, blood flow to the urinary decreases, blood flow to the digestive system decreases. Okay. Okay. I like the way you guys are answering very fast. This is the kind of pace I need. I don't want anybody, don't open your slide. Just answer. If you fail, you get it wrong, that's still fine. Look at this question. Glomerular filtration occurs because of glomerular oncotic pressure overrides glomerular blood pressure. True or false? True or false? Perfect. You guys are so correct. It's false. When we say glomerular filtration, we already know what filtration is. So glomerular filtration occurs because glomerular oncotic pressure overrides glomerular blood pressure. Glomerular blood pressure is that hydrostatic pressure I told you. If you remember, like people that have been in my class, yes, it's false. You remember when I was pushing? I am the glomerular blood pressure. That's the hydrostatic pressure. Pushing. Then the other person has two forces pushing at me. One is oncotic pressure. The other one is what? Is the capsular pressure. So because I am bigger than them, that's why I'm able to what? Cause filtration. Remember, because I am bigger than them, I am 60, two of them combined is 1832. That is 50 years. So I am bigger than, I overrode them, that's English, right? With 10 millimeter mercury. That's why filtration is able to go downwards towards the tubes, all right? So please, you need to bear this in mind. Okay. Let's see. Look at this. True or false? Very slick question. Very slick. True or false, guys? I need the answer like this. Just pium, pium, pium. Don't open your slides. You are wasting your time. You won't use it in exam. Don't use AI. You can never use it in exam. Don't use Google. You will never try it in exam. Only one thing I ask you to use, one technology I ask you to use is your brain. So I need you to answer this as if you're in the exam hall, so that will be faster, right? Even if you get it wrong, that's fine. Quickly, guys. Quickly. Good. So the answer is false, guys. Please, if you see this question in the exam, pick false. Think about it. This is exactly the same question we answered initially. All right. Sympathetic action. Think of when you are running. Do you feel like peeing? No. So the bladder is relaxed to accumulate and store what? Urine. You understand? So the bladder, the detrusor muscle of the bladder relaxes. You understand? It does not what? What's the question? Contract. It doesn't contract. What causes contraction is the parasympathetic what? Stimulation. That's, we call it voiding phase. All right? So, or maturation. It causes maturation. That's parasympathetic, not sympathetic. Do you understand? Because the parasympathetic nervous system, right, through the pelvic nerve takes over in voiding. And how does it happen? It releases what? Acetylcholine, which what? Stimulates muscarinic what? Receptors. If you were in my class when I taught neuro, you will understand what I'm saying. You understand? So the parasympathetic through the pelvic nerve causes release of what? Acetylcholine, which stimulates muscarinic receptors. That's M3, specifically M3 receptors on the detrusor muscle. When it releases this on the detrusor muscle, it causes the detrusor to contract and squeeze urine out of the bladder. So the answer to this question is what? False. Please, I need you to pay attention, all right? If you get it wrong, don't feel bad. It's fine. It's better you get it wrong on my channel than getting it wrong in class, all right? Okay. Yes, it's false. Look at this question, guys. Diseases that affect the descending corticospinal tracts may limit inhibition of the sacral somatic motor neurons and thus could result in urinary incontinence. True or false? True or false? This question will really hit people that didn't do neuro properly because, as I told you, anatomy has a sequence. Come on, guys, keep going, keep attempting. If you don't know it, write 911. That's fine. Okay, guys, perfect. The question again: diseases that affect the descending corticospinal tract may limit inhibition of the sacral somatic motor neurons and thus could lead to result in urinary incontinence. Please, the answer is what? Capital yes. Capital yes. And I'll tell you the pathophysiology. But first of all, before I tell you the pathophysiology, you need to know that these diseases, all right, or injuries that damage that descending because corticospinal tract is descending. You understand? It's called descending corticospinal tract or upper motor neuron pathway. Upper motor neuron pathway. Pay attention. Oh. If this pathway disrupts, it can lead to, you understand, inhibitory loss of inhibitory control. The brain, I'm trying to put it in a very mild way. You understand? Because if I'm talking about the pathophysiology of this problem, you think of the somatic control, think of the brain's inhibitory role, then think of the upper motor neuron lesion. These are the three major things you need to think about. First of all, we have something we call the somatic control, right? The bladder has the external and the internal. And we say that the external urethral sphincter is composed of what? Skeletal muscle. Remember, skeletal muscle, and it is under what? Voluntary control. If you were in my class, I mentioned it, that the external urethra, you understand, urethral sphincter is composed of skeletal muscle, and it is what? Under voluntary control. So it's also called somatic control. Voluntary, somatic, skeletal. Remember that. You understand? So, and they all of them, their innervation is from S2 to S4. S2 to S4. So keep that somatic control in one side. Now, for you to hold your urine, the brain will tell you to hold that urine. So under normal resting condition, like when you are under normal resting condition, the brain will send inhibitory signals down through that descending spinal cord tract, right? Such as what? Corticospinal or reticulospinal. I need you to follow my explanation. I've told you about the somatic control. Keep it one part. Now I'm telling you about what the brain does. The brain does something we call brain inhibitory role. When you are at rest, you understand, or under normal condition, the brain will send signals. We call it inhibitory signals through the corticospinal or reticulospinal tract. It will send this signal to that somatic that I kept one place, that somatic motor neuron, and tell it, I don't want you to fire inappropriately. I don't know if it makes sense. I don't want you to do what? Fire inappropriately. So it is the brain that is helping that external sphincter not to open. Does it make sense? Now, the brain is giving it this command not to fire inappropriately through corticospinal and reticulospinal. This is physiology. Think about it. If something happens to your corticospinal or reticulospinal, do you understand? If something happens to that corticospinal or reticulospinal, what will happen? The brain will no longer have a way to tell the somatic, that's the voluntary control, not to fire. So what will happen? It will just be firing by itself. And it immediately is firing. That external sphincter becomes what? Involuntary. Instead of voluntary, you can no longer hold your urine. Urine will start what? Leaking. Somebody is saying, what is this boy talking about? The spirit is telling me what somebody is saying right now. Do you understand? So that neurological bladder incontinence, right, is usually, when there is no cortical inhibition. So there is no inhibition. It usually happens for people that have multiple sclerosis, stroke, or even traumatic spinal cord injuries. Most of these things are diseases that affect what? Descending tract. So any disease that affects the descending tract will definitely cause this incontinence. And the pathology is just that the brain is not able, the road, you understand, or the vehicle that the brain sends message to go and tell the external bladder to lock up so that urine don't just fall out, has been destroyed. So the brain is no longer able to control that, help that external. So you cannot help and you are in control of your brain, right? You are the one that will be like, you know what, I'm not urinating now. Immediately I say, oh, I'm not urinating now. Pew! The information passes through corticospinal and reticulospinal. Pew! To my external sphincter. External sphincter will lock up. That's why even when you want to urinate, you hold yourself. You tell yourself, no, I cannot urinate here. Pew! Lock up. But then just imagine when you are telling yourself, I cannot urinate, but that information is not getting to your bladder. What will happen? Pew! On your clothes. I believe you guys understand. Please, if you understand, the people that say 911, if you understand now, because I'm trying to explain in different ways, tell me yes, you understand. Talk now, talk. Nobody's talking. Tell me yes, you understand. But if you don't understand, you can always go back to the video. Slow me down, because I know I talk very fast. Please, slow me down and listen to it again. It will make sense to you. All right? I got it. Perfect. Okay, let's go. Look at this question. True or false? Perfect, guys. Look at this question. True or false? The ureters pass anterior to the bladder. The ureters pass anterior to the bladder and enter it from below. That's anatomy of the ureter. True or false? Anatomy of the bladder and the ureter. Does it pass anterior? No, I'm not repeating the same thing. It's your computer that is acting. Come on, guys. Are you guys still mesmerized with the other question? Those are the kind of question you will see. Answer this one quickly, guys. We've not even entered the medicine. Yes, the answer is false. It doesn't pass anterior, it passes posterior, all right? No, the answer is false. It passes posterior, not anterior. Please, don't forget it. It passes what? Posterior. Passes posterior. The ureter is hiding from the bladder at the back. Remember that. Look at this question, guys. Alcohol stimulates the secretion of ADH, thereby reducing reabsorption by the collecting ducts. True or false? These people are crazy. Come on, guys, let's go. Come on. I need energy in this house. Where is my people? Where are my people? Energy, guys. Energy. Energy, guys. Okay, yes, the answer is false. Guys, listen, that question is two parts. Alcohol stimulates the secretion of ADH. False. Alcohol reduces that ADH secretion. Do you understand? If ADH is secreted, it will reduce reabsorption by the collecting duct. True. You understand? So the second part of the statement is correct. You understand? But the first part is not correct. The first part, alcohol actually reduces reabsorption. Yes, that one is correct. But alcohol does not stimulate ADH production. So that makes that answer wrong. So the answer is false. Alcohol decreases secretion of what? ADH, not stimulates. Put it in your head. Alcohol decreases the stimulation of antidiuretic hormone, vasopressin, and it does not what? Increase. It decreases. It doesn't stimulate. It inhibits. Okay. See how I'm saying it now? Look at this question. Albuminuria is a common sign of diabetes mellitus. True or false? Okay, so the answer is false. The answer would have been true. Guys, listen. The answer, in case of, because why I'm one of the ideas of this class is for you to just have that knowledge, all right? Because you may be writing an exam and they'll give you this question in a very different format. The answer would have been true. Do you understand? If maybe this question is asking you about diabetic nephropathy, there's a difference between diabetic nephropathy and diabetic mellitus. All right? When you're talking about diabetic nephropathy, Do you understand? You are talking about what? Diabetic kidney disease, not the diabetes itself. But this question is asking, they are just using your brain. This question is just asking about diabetes itself. All right. So the answer is false. You understand? Diabetes itself, you are talking about what? Glucosuria. You understand? Then all this polyuria, polydipsia, polyphagia. That's what you are talking about, diabetes mellitus itself. But when you're talking about diabetic what? Nephropathy. Diabetic nephropathy. Then albuminuria can be a hallmark. All right. So for this question, it's false. Look at this. True or false quickly, guys. True or false quickly. True or false quickly, guys. Parathyroid hormone increases phosphate excretion by the proximal convoluted tubule as well as promotes synthesis of calcitriol. The answer is what? Freaking true. You understand? These are the kind of questions you see. Your confidence will build. All right. The answer is true. Remember, parathyroid hormone is PTH. What is PTH? I told you, phosphate trashing hormone. It trashes phosphate, right? Thereby increasing what? Calcium. All right. That's why it helps and promotes, the synthesis of what? Calcitriol in the kidney. And remember how calcitriol forms. It starts from the skin, cholecalciferol. From the cholecalciferol, it goes to the liver and converts to what? Calcidiol. That's 2-ol. All right, 2-OH. Then from calcidiol, it enters the kidney. Those ones are, cholecalciferol is inactive in the skin. Like, everybody say, oh, the skin produces vitamin D. True, but it's inactive, the vitamin D. So that inactive vitamin D goes to the liver. You understand? As cholecalciferol. And in the liver, it turns to calcidiol. It's still inactive vitamin D. Then from the liver, it migrates to the kidney. In the kidney, it becomes what? Active vitamin D, which is what? Calcitriol. 3-ol. Calci-3-ol. All right? Parathyroid hormone actually helps for its synthesis. Please bear that in mind. But most importantly, phosphate trashing hormone. All right? See this one. This question. No, I'm wasting too much time in this true and false. So, guys, quickly. The thick segment of the nephron loop is impermeable to water. True or false? It's impermeable to water. True or false? Come on, guys. Let's go. We are talking about the thick segment of the nephron loop. Remember, from the glomerulus, you understand, which is part of the corpuscle. Remember, I told you the corpuscle is made up of what? The corpuscle is made up of what? Cup parts. You understand? And the tube parts. The capsular part, the tube parts. Very, very important that you know that. So that's two parts, So that two parts, that's the tubular part. It starts with PCT, then loop, then DCT. Remember, I told you collecting duct is not part of it. It's not part of the nephron. Collecting duct is never part of the nephron. All right? Very, very important. Yes, you guys are so correct. You guys are so correct. Everybody here is correct. So the thick segments of the nephron loop is impermeable to water. It's only permeable to what? Solutes. All this sodium, potassium, this one, that's what is permeable to. You understand? It's permeable to solute, but not permeable to what? Water. So it's actually impermeable to water. Remember. But that thin descending loop is permeable to what? Water. The thin one, not the thick one. Wisdom. Don't forget. We are still in true or false. All this is testing the microphone. We are just testing the microphone, guys. You understand? So don't think we have gone any this thing. No. Look at this question, guys. The countercurrent multiplier mechanism for water conservation was discovered by limiting studies to humans and thus hypothesizing how form determines function. These people want me to bite my tongue. They are just discussing about current mechanism. Very important. But I want you guys to attempt this question. I know some of you may not have seen it, but I want you to attempt it. Quickly, guys. Remember what I told you countercurrent multiplier is. Quickly, guys. Okay. Because this one is not very familiar. Please, you guys are very correct. The answer is false. All right. It wasn't achieved by limiting studies to humans at all. In short, it was discovered by studying the comparative anatomy and physiology of desert rodents. All right. And rodents and what's the name of this thing? Rodent and other mammalian species. You understand? Just to determine the anatomical form, or to highlight that anatomical form determines function. All right? Like how it is in terms of form. You know, the countercurrent multiplier is like this and like this. So the two of them goes hand in hand. All right? So because of that, it's showing that how they are determines their function. Chicken. So it doesn't limit. This place says limiting studies to humans. No, it doesn't limit humans listen at all. So the answer to that question is false. All right? In case of if you see something like that. Let me see this question. Look at this question, guys. Angiotensin converting enzyme is found only in the kidneys and converts angiotensin to angiotensin 1. Answer. For people that are paying attention. For people that are paying attention, what's the answer to this question? Let me see now. Let's go, guys. Let's go, guys. Okay, you guys are so correct. The answer is false. There are two things that make this answer false. First of all, ACE, angiotensin converting enzyme, is found primarily in the capillaries of the lungs. You are correct. I think it's found in the lungs. You are very correct. In the capillaries of the lungs. You understand? Not just the kidneys. It's also found in the endothelial surface of blood vessels throughout the body. Very funny. Do you understand? Now, the second thing that makes this statement wrong is that the statement says angiotensin converting enzyme is found in blah, blah, blah in the kidneys and converts angiotensinogen to angiotensin 1. It's not, it doesn't convert angiotensinogen to angiotensin 1. What converts angiotensinogen to angiotensin 1 is what? Renin. That is from the kidney. Renin, not ACE. Instead, ACE converts angiotensin 1 to angiotensin 1 active angiotensin 2. You understand? So you have to remember this, you know. And I was telling you guys something in class about medications. You see, the medications you give in the clinic, like all of you are nurses. So the medications you give in the clinic that ends in pril, you know, all this lisinopril, captopril, all of them are ACE inhibitors. Remember, I told you that the RAS system, renin angiotensin aldosterone system, is a system that helps to bring up your blood pressure, not reduce. So when your blood pressure is low beyond normal, it helps to bring it up. So that's why somebody that is hypertensive, all right, what do? We give that person an inhibitor to anything that can bring the blood pressure up. And one of them is ACE. That's why one of the most popular hypertensive medications are found in this pathway, in the RAS pathway. And most importantly, the pril drugs, pril, lisinopril, captopril. Although if you see a doctor giving that drug, the doctor is just giving that drug so that it will go and inhibit ACE. And if ACE, angiotensin converting enzyme, is inhibited, angiotensin 1 will not be converted to active angiotensin 2. And remember, I told you, when ACE converts angiotensin 1 to angiotensin 2, it does three things. One, it causes you to be thirsty. It goes to the hypothalamus and makes you to be thirsty. And you drink a lot of water. When you drink water, it will be absorbed into your bloodstream. Your blood volume increases, your blood pressure increases. Secondly, it causes vasoconstriction, which helps to raise the blood pressure. Third one, it causes what? It goes to the adrenal cortex, right? The first part of the cortex, that's glomerulosa, and cause the production of what? Of mineralocorticoids. Example, aldosterone. When aldosterone is produced, you understand, aldosterone has a salt-sparing effect. It will spare the salts. So there will be a lot of salt in your blood. And if there's a lot of salt in the blood, it draws water in the blood. And when there is water in blood, volume increases. When volume increases, blood pressure increases. So this is the way this system functions. You must know this system by heart. A lot of questions will come out from it. Joke aside. All right? So you need to know this question. And this is multiple choice exam. So they can ask you question technically from anywhere. All right? Okay. Let me finish up this. Look at this question. This one is a giveaway. Like, I need very fast response. Very fast response. Glomerular capillaries suffer little damage from hypertension because of the protective influence of the afferent arteries. True or false? True or false? Quickly, guys. If you don't know it, write 911 instead of keeping quiet, please. It's fine if I get 10 911s. It helps me to explain better. You guys should not kill the vibe. Oh, yeah. Come on, guys. Somebody's writing through our voice. You guys are making me laugh. So, guys, the answer is false. Listen to the question. It says, glomerular capillaries suffer. Remember, capillaries are small, very small. Remember? And where is the capillaries again? Remember, I told you the afferent, A before E. The afferent enters the glomerulus, right? That's the GFR. Then from there, come out through the efferent. From the efferent, it now goes to the capillary. You understand? Then this says glomerular capillaries suffer little damage from hypertension because of protective influence of afferent. Afferent has nothing to do with it. Afferent actually try to lock up. Remember, I told you when the blood pressure is high, afferent locks up, closes the door. all right, so that they don't rush in. It helps only for transient hypertension, like acute. You understand? That's when it protects the capillary. But when the hypertension becomes chronic, in short, the second leading cause of end-stage renal disease, ESRD, is what? Chronic hypertension on the capillaries. So it doesn't protect it too from chronic hypertension. So the answer is false, guys. The answer is false. Remember that too. This one is giveaway now. Why is this question here? Anyway, the truth of the matter is that people get the cheapest question wrong. So the answer to that question is false, all right? Look at this question. The fenestrated endothelium of the capillary has pores small enough to exclude blood cells from the filtrate. True or false? Quickly, guys. Let me give you guys the concept to this question. Remember, I told you something. I told you that anything above 8 nm, right, cannot pass through into the filtrate, right? That's what I told you. And what are those things that are protecting the things from passing through? I mentioned the endothelium that stops anything above 90. Remember? Then we mentioned the slits that are created by the podocytes. It stops anything above what? 30. Then at the end of the day, we mentioned the ion gel. You understand? That gel area where there is ion blah 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 that protects anything above what? 8. That's what they're asking you here. So that fenestrated endothelium of the capillary has pores small enough to exclude blood cells from what? The filtrate. True or false? No, kidney. We are talking about the kidney now. The answer is true. Come on now. We are doing physiology. Do you see blood in your urine when you are urinating? No, it's the endothelium that stops it. I told you the first one is endothelium. The second one is the slits caused by the podocytes, right? In the visceral part of the capsule. Then the third one is what? Is that electron area that stops anything above 8 nm. Remember the three of them. They will ask you this question in different formats. This is one of the formats. All right. I think that's all for true or false. That's all for true or false. Now let's go to the main thing. I think your question may be more than 75, because that's what the spirit is saying right now. Yes, Father. 100? Oh no, Father, I've told them 75 now. Please. Father, you know what? Let's leave it. Let's discuss this later after this live, all right? So, guys, you see but you guys heard it, right? You heard the spirit talking to me. Did you hear it? You heard? Somebody said, don't start. So you did not. Oh, Jesus. Oh, Jesus. Your let is laughing. You people did not hear anything. Hey, I really thought, am I crazy? No. Say, Professor, stop. Oh, God. Okay. There are some questions I'm not going to ask. Micturition is another term for elimination of urine. That one is something I'm not going to ask you here. Look at this question. I'm scared. Please don't be scared, all right? The truth of the matter is that the more the question, the better for you. I really want to cover every area so that, when you see your midterm, you won't see anything surprising. You understand? But, just urinary alone, I have almost 60 questions here. Your questions can come from anywhere. That's why the more the better, the more the merrier. But let's leave that. Later, I'll discuss with the spirit personally, all right? Look at this question, guys. You have to pay more than usual attention. Look at this question. Which of the following is not found in ureter? Which of the following is not found in the... I don't know if I can open a word page. Let me see. Yeah. Hold on, let me see. I want to see if I can open a page here. Share. Okay. Yes, I will. Just give me a moment. I'm trying to make it faster. I'm looking, you don't understand. I have too many things here that we have to discuss, and the time is limited. It's already 7:30. You understand? So I'm looking for the best way to, make this thing faster. All right. So just give me a moment. Can you see this thing from your screen? If you can see it from your screen, tell me. Yes. Yes, perfect. Perfecto. Okay, so those are the options. A is adventitia, B is 2 layers of smooth muscle, C is 3 layers of smooth muscle, D is urothelium, E is skeletal muscle. Quickly, which of the following is not found in the ureter? Which one is not found in the ureter? Guys, you guys have to be very fast. All right, you have to be extremely fast. We already used them almost an hour just for true and false. Imagine. Oh Jesus. Oh Jesus. Oh Jesus. Quickly, my people, quickly. What was the answer? A, B, C, D, E. Yes, guys, the answer is E. Skeletal muscle. You guys are very, very correct. The answer is E, skeletal muscle. I believe everybody understand. Somebody said D? No, not D. D is urothelium. No. Urothelium is the same thing as transitional epithelium. Ureter, bladder, they are transitional epithelium, all right? I heard 2 layers of smooth muscle, yes. 3 layers of smooth muscle, yes. Adventitia, yes. Urothelium. So the answer is skeletal muscle, guys. You don't have control of it. You really don't have control of it. Look at this question. Somebody said, what did he say? He said, I am confused. I thought skeletal is D. No, skeletal is E now. Look at it. A, B, C, D, E. D is urothelium. Sorry. I think maybe you have a problem with the numbering, eh? Okay. Okay, so look at this question. The dash muscle is located in the urinary bladder. Which one? Which muscle is located in the urinary bladder? Guys. Which one? We have A, detrusor, B, detractor, C, pubococcygeus, D, corpus spongiosum, E, corpus cavernosum. Quickly, guys, quickly. The faster, the better. Quickly, guys. Yes, the answer is the truth, sir. Hold on. Checking these questions properly. Because of the great deal of active transport. Just a moment. So look at this question, guys. Yes, the answer is the truth, so we need to be very fast, all right? Look at this question, guys. Because of the great deal of active transport that occurs here, the dash of the nephrons collectively account for about 6% of one's daily resting ATP and caloric consumption. I'll give you the options. Oh, I want you to. So look at the options. A, proximal convoluted tubules. B, distal convoluted tubules. C, nephron loops. D, collecting ducts. E, glomeruli. Which, quickly, guys. Quickly. Quickly, guys. Yes, the answer is proximal convoluted tubule. Very nice. Very, very nice. It's not a function of the kidney. Look at this question. Very nice. You guys need to be extremely fast. Like I'm trying to be to fast hasten up. I'm being too relaxed. Which of the following is not a function? I think it's the only place in the urinary where active transport. Yes, if you remember when I was telling you about potassium and sodium, how sodium deceives potassium, that's active transport. Yes, that's the place. Proximal convoluted tubule. Remember that. Look at this question. Which of the following is not a function of the kidney? Which of the following is not a function of the kidney? Let me give you the options, guys. Look at the options. Look at the function options. This is A, this is B, this is C, this is D, and this is E. Yeah. So they regulate osmolarity of the blood fluid. They fight osteoporosis by synthesizing vitamin D. They help control blood pressure. They release the majority of waste into the bloodstream. They indirectly increases oxyhemoglobin. Quickly. Which of the following is not? Pay attention, oh guys, so that you don't be fooled. Not. Quickly, guys. Quickly. Quickly, guys. Perfect. The release of waste into the bloodstream. Somebody will laugh and be like, this thing is very easy. It's easy. It's easy. Actually, you understand, but some people may not get it. Look at this question, guys. The byproduct of protein catabolism constitutes Dash constitutes approximately one half of the nitrogenous waste. He's just asking you what is the byproduct of protein catabolism. Quickly, guys, what's the byproduct? Urea, creatinine, uric acid, azotemia, ammonia. Quickly. When protein is broken down, what does he give? Oh, you need to know when protein is broken down. When nucleic acid is broken down, and when creatinine is broken down. Or creatine, rather. Quickly, guys. If you are feeling sleepy, do like this, do like this. Everybody, move your body, move your body. Mm, mm, mm. You are busy laughing instead of you doing what I'm doing. If you are like, be sleeping. Because I can see somebody sleeping right now. Move your body, guys. Like this. Stop laughing. Like this. Somebody say A and B. It cannot be A and B. It's one option. It's one option. Oh. The byproduct of protein catabolism. I remember discussing it. It's in number 2 of your slide. Quickly, let's go. We don't have time. I don't want to finish by 12. Is it urea that you guys are thinking? Listen, you're supposed to produce the answer very fast now. The answer is urea, guys. They will ask you about oxygen, organ system that excretes nitrogenous waste. It's urinary system. You guys know that already. You know cardiovascular does not secrete waste, so you know that answer. Yes, you know that. I'm really trying to be fast. I don't want to put everything here. Look at this question. The medial concavity of the kidney is called the dash, which admits renal nerves, blood vessels, lymphatic vessels, and ureter. I'm not giving you option. Answer. Answer, guys. What was the answer, guys? Why are we slowing down? I'm already getting the next question. Answer, guys. We are wasting too much this thing. Oh. If it's only 2 chapters that we are able to do, fine. No. I want us to do at least 3 chapters for your exam purposes. But you guys are slowing down. You've lost the momentum. Yes. Okay, hilum. Okay. They can ask you another question about the hilum. They tell you blood pressure, blood vessels, nerves, and renal pelvis enter or is it the kidneys through the hilum? The hilum is the door. Remember that. I'm not gonna ask that question. Even this one, I won't give you option for this. Look at this. Second. I won't give you option for this. The renal pyramid voids urine into the dash. Pyramid voids urine into the dash, guys. What was the answer? Pyramid voids urine into the dash. Somebody say 911. 911 in what? The renal pyramid. Remember, at the pyramid, guys, the pyramid, that's where you have what? The papillary duct. The papillary duct is found at the pyramid. I told you now, it's like a funnel. That ending of it. That's where you see the papillary duct. Remember, the collecting duct, which collects urine from the distal convoluted tubule, different distal convoluted tubule collects urine, collecting duct to the papillary duct in the renal pyramid. Then that urine there in the renal pyramid is voided into what? The minor calyx. From the minor calyx to the major calyx. From the major calyx, you understand, to the pelvis. From the renal pelvis to ureter, from ureter to bladder, from bladder to urethra, from urethra to your toilet. Okay. I explained it because of the 911 group. Look at this question. Look at this question. Where is blood plasma filtered? Blood plasma, where is it filtered, guys? Filtration, where does it really happen? Look at it. Renal tubule, renal corpuscle, renal capsule, renal column, renal calyx. Quickly, guys, quickly. This thing is a very... I've told you, stop opening your book. I see you opening your book. I see you. The spirit is making me see you. Open my eyes to see you that you're opening your slide. You don't need to open your slide. Answer this question as if you are in the hall. If you do that, you'll be faster and it will help you build confidence. Because you must pass. You don't have a choice. You cannot be with me here with all these hours and you will not pass this exam. It's impossible. If you don't pass, I will sue you. I'll sue you for wasting my time. This little question is shaking you guys. I've not even gotten to the hard part. This is just testing the microphone. Yes, the answer is renal corpuscle. That's where it stops blood from going into the tubule. Okay. Yes, renal corpuscle. Yes, glomerulus is part of it. Look at this question. Yes, renal corpuscle, that's the answer. Look at this question. A single lobe of the kidney is comprised of what? A single lobe of the kidney is comprised of what? Can you guys remember what I said? Look at the options. Answer, guys. I hope you can see this blank stuff very well. Comprises of 2 calyces and a renal pelvis, 1 pyramid and overlying cortex, 1 major calyx and all of its minor calyces, a renal medulla and 2 renal columns, 1 collecting duct and all the nephrons that drain into it. I'm sorry to hear that. Sorry. Take care of your son, all right? Yeah, even if you are in part of this class, you have to still watch this video over and over again. Honestly. But participating is very, very important, all right? But go take care of your son, all right? Answer, guys. Yes, you are very correct. The answer is B. 1 pyramid and an overlaying cortex. I remember singing this. I was singing it. I told you the average person has approximately 1.2 million nephrons. Don't forget that. 1.2 million nephrons. Look at this question. Let me see. This question looks interesting. Yeah. Look at this question, guys. Which of the following form the inner layer of the glomerular capsule and wrap around the capillaries of the glomerulus? We have the macular denser cells, we have the messenger cells, we have the nephrocytes, we have the podocytes, we have the monocytes. Quickly, guys. Come on, guys. Come on. Let's push. Let's make it faster. Which of the following form the inner layer of the glomerular capsule and wrap around the capillaries of the glomerulus? This is giveaway now. The inner layer of the glomerular capsule, that's the capsule, that's the visceral capsule. I told you that the visceral capsule inside is made up of something. And that thing is what stops. It looks like a food processes. What was the name for it? Somebody say, okay. Write the answer now. Write it. Write it. You see? You see what I'm saying? Yes, it's okay. You change the answer quick. I know now. I catch you. I tell you that I hear things. The spirit is ministering unto me. But you people don't believe me. You think I'm playing. Okay. Yes, the answer is podocytes. You guys are correct. Podocyte looks like food process. I've already told you guys the major calyces form pelvis, right? So I'm not answering this question. Let me see who was paying attention. Look at this question. Which of the following is not composed of the cuboidal epithelium? Is not composed of the cuboidal epithelium. Options. The thin segment of the nephron loop, the thick segment of the nephron loop, the collecting duct, the proximal convoluted tubule, the distal convoluted tubule. Let's see who was listening, who was paying attention. Which of the following is not composed of the cuboidal epithelium? Quickly, guys. 1, 2, 3, 4, 5. 5 out of 40 something people here. Hey, what is happening? Yes, the answer is A. That's the thin segment of the nephron loop. I told you that thin segment is the one part in the body that has what? That has what? What does it have? One person. Just give me the epithelium. Give me the epithelium of the thin segment of the nephron loop. Just one person. What's the epithelium? Simple squamous. Perfect. Another place you see simple squamous is the alveolus of the lungs. All right. Okay. Look at this question, guys. Look at this question, guys. Interesting question. I love it. Cortical nephrons can be distinguished from juxtamedullary nephrons by what? Let me give you options. Look at it. A, B, this side, C, D, E. Okay. They are short, cortical nephrons. They are shorter. Okay. Yes, that's one of the differentiating this thing, but is it in the option? So look at the option and see. Ha. Ha. Thank God I put this question though, because if not, if people see this question in the exam, they may be confused. Again. Somebody say, how? It's true now. Okay, yes, you guys are so correct. The answer is D. The allocation within the renal cortex. So the person that said the size of the C, I know you have an idea. Size is actually a differentiating factor, but they are saying the size of their renal corpus. No, it's the size of their tubule. You understand? It's the size of their tubule. That's why there you will not see size of tubule. Instead, you see the size of renal corpus because they want you to pick it and you get it wrong. The answer is their location within the what? Renal cortex, right? One is in the cortex itself. The other one is in the cortex, then down in the medulla, just at the medullary nephron. Okay. Okay. Let's see the fast fingers. Yes, that's fine. That's fine. So look at it. Which of the following correctly traces blood flow from the renal artery into the renal cortex? Let's see the fastest. Your exam is both pace and accuracy. Aha. Let me reduce the size of this thing. This is A. This is B. This is C. This is D. And this is E. Quickly, guys. Which of the following correctly traces blood flow from the renal artery into the renal cortex? Which one? Come on, guys. Come on. Fastest. Just act as if you're in the exam hall. Stop looking at your slide. Yeah, you are looking at your slide. I can see you. You are looking at your slide. Stop looking at your slide, making you waste time. In the exam, you will not use that slide. Quickly, guys. Come on. You guys are wasting so much time. Oh. The answer is C, guys. Segmental artery. Let me see what people choose. Somebody said D. Let me see D. Afferent artery. Cortical radius. No, now this is, that one is even so disorganized. No. You see afferent artery inside after cortical radiator. Now. You understand? So C says segmental artery, interlobar artery, arcuate artery, cortical radiate artery. The same thing as interlobular. You understand? They are just putting that to confuse you. You understand? Somebody said, let me see. Somebody said E. What is in E? Segmental arcuate artery. No, now that's very disorganized. So the answer is C, guys. Look at this question. I really wish you guys can answer faster, because if you can answer faster, then I'll be able to go faster. In the nephron, the fluid that immediately precedes urine is known as what? Plasma, glomerular filtrate, tubular fluid, renal filtrate, and medullary filtrate. Oh, Jesus. What is happening? Are we tired? You want us to postpone it to another day? We're only in the urinary and you are tired. Even the urinary have not even gone anywhere. Please, that's why you need to put something beside you that you're drinking like me. Even me, I'm drinking it. Yes, the answer is C, tubular fluid. C, tubular fluid. In a very healthy kidney, yeah, so you guys have to be faster, please. In a very healthy kidney, the little dash is filtered. We have amino acid, we have electrolytes, we have glucose, we have vitamins, we have protein. What's the answer? In the healthy kidney, very little dash blank is very little dash is filtered by the glomerulus. Quickly, oh, right. What is happening to my people? Oh, you guys started so strong, oh. Suddenly you are losing your swagger. You are losing your swagger. You are losing your swagger, guys. Okay, guys, the answer is protein. If you look at every other thing can be filtered. Remember, this is filtered. This is not talking about coming out in the urine. He said, in a healthy kidney, very little dash is filtered in the glomerulus. Everything can pass, but protein is too heavy. Protein will not be filtered. So the answer is E. Please, you have to pay attention to the question so that you don't get it wrong. A lot of people are saying glucose. I agree. Glucose, I don't agree rather. Glucose can be filtered. Electrolytes will be filtered. Amino acids will be filtered. Vitamins will be filtered. Do you understand? And when they are filtered, they will now be what? Reabsorbed. You know, but protein will not be filtered. Extremely important that you know that. Okay? Look at this question. Quickly, guys. Quickly. Assuming all the values are normal, calculate the net filtration pressure in the patient with a drop in capsular hydrostatic pressure to 8 mm. Quickly. Quickly. Answer. Do you need options? Option is 10, 20, 30, 40, 50. That's the options. Quickly, calculate and give me your answer, people. Wow, only 3 people. This is getting serious. Yes, the answer is 20. Somebody said 911. Yeah, you remember I told you I am hydrostatic pressure. What is hydrostatic pressure? 60 mmHg, right? And this hydrostatic pressure is pushing against these 2 people. And these 2 people are oncotic pressure. You understand? Oncotic pressure, which is oncotic pressure is how many again? 32. Yes. Oncotic pressure 32. You understand? And the hydrostatic pressure is I think 18. Yes. So the 2 of them make NPF of what? 10. But in this case, they told you that the capsular pressure dropped from 18 to 8. So what do? Just add the 32 to the 8. What will it give you? 40. Hydrostatic pressure is 60. 60 minus 40 is 20. That's how you get your answer. If you know it, you know it. If you remember the explanation I gave about me pushing somebody that has 2 hands, one is 32, one is 18, that's 50. Me, I push them with 10 because I'm 60. That's exactly how you solve this question. I hope the 911 person understands now. The 911 person, do you understand? Say yes, let's move. Yes. Okay. Renin hydrolyzes angiotensinogen, which is released from the dash to form angiotensin 1. Where is angiotensinogen released from? You don't need options for this. Answer. Angiotensinogen. I've mentioned it before. I shouldn't even ask this question. Where is it released? Quickly, guys. Perfect. Liver. That's the simple answer. No time to waste time. Life. It's liver. I know your keyboard is playing tricks on you. Look at this question, guys. Look at this question, guys. Which of the following would reduce the glomerular filtration rates? More like what will reduce our blood pressure if blood pressure is high. That's just what I'm asking you. You understand? So this is A. A drop in narcotic pressure, vasodilation, and this. Answer, guys. Yes, the answer to that question is liver. You're correct. So answer to this one, which of the following would reduce A, B, C, D, E, F? Vasoconstriction of the efferent artery, a drop in oncotic pressure, vasodilation of the afferent artery, vasoconstriction of the afferent artery, an increase in osmotic pressure in the glomerular capsule. Quickly, guys. Quickly. What did I tell you? Anytime you see efferent and afferent, which one are you targeting? Which one are you targeting, guys? Don't need to target the afferent, the afferent. A. You understand? A before you target the A. Then now you now know if it is what? Constriction or vasodilation. If blood is rushing, people are 100 people are rushing to pass through the door, and you don't want them to rush into the door, into the class. What do you do? That's what they're asking you. What do you do? Do you close the door or do you open it wide for them to enter? If maybe there are too many people in that class, you understand? That is high blood pressure. There are too many people, and you don't want the thing to keep rising. What do you do? Do you open the door wide for people to enter, or you vasoconstrict it? Do you vasodilate the door, or you vasoconstrict it? Which one? You close it. Perfect. So what should the answer be? Let me see who picked. Izana. So what should the answer be? Yanelis. So what should the answer be? With what I just explained. You are still, you still don't understand it. If you're let me re-explain it, so that you understand it. Yanelis and Izana. God, so now you get it. So what I'm saying is, they are telling you that which of the following we would reduce the glomerular filtrate rate. So a lot of filtrate is running very fast to enter the class. If you want to reduce the speed of anybody running into the class, what do you do? Do you vasodilate, open the door wide for the person to keep running fast? Or do you vasoconstrict? Okay, you confuse. Oh, perfect. If it's the letters that is confusing, no problem. Then that means you are good. Yes, that means you are good. I was thinking it's just the concept that is confusing. So the answer is vasoconstriction of the afferent artery. Yes, constrict. And what are you constricting? Efferents. Yes, that's what I wanted to hear. Nah, maybe we'll take. Look at this question. The mechanism of stabilizing the GFR on the tendency of smooth muscle to contract when stretched is known as what? I told you anything muscle is called what? Anything muscle is called what? Yeah, it's good that you think. I really like the way you answer very fast. You seem to be the fastest, which is nice. That means you are very active. It's good that you're answering without even you are giving your answer. It's fine. If you are wrong, you get it right next time. Yes, the answer is myogenic mechanism. You're correct. Okay, I've given this question. Glucose and amino acids are resin. Oh, look at this question very fast. Where does reabsorption happen? Where does it happen? Quickly, guys. This is a giveaway question. I'm jumping a lot of questions right now. Quickly. Quickly, guys. Yeah. Hold on. Yes. I'm trying to check out these questions. Okay, there are some questions I jumped that are important though. Yeah. Okay. So, guys, sorry, I was carried away with some of the questions. Yes, the answer is B. The answer is B. Proximal convoluted tubule. I was carried away with which of the is not resolved in proximal convoluted. I was carried away because there are some questions that I should have asked that I forgot. Look at this question. Hypocalcemia stimulates when somebody has a low calcium. What will be produced in the body? When somebody has low calcium, what will be produced? Look at the question. Look at the options. Decrease in aldosterone production, secretion of parathyroid hormone, secretion of renin, an increase in blood urea, nitrogen vasoconstriction of the afferent arteries. What will happen when you are hypocalcemic? Quickly, guys. Yes, the answer is B, secretion of parathyroid hormone. Remember, parathyroid hormone is what we trash out, phosphates to bring in calcium. So when calcium is low, we are begging parathyroid to come. Oh, please, they'll come and help us and bring what? Calcium. Don't forget that. 32, 37. It's 37, but I missed something. Look at this. Which of the following is not true about the anatomy of the urinary system? Have I asked this question before? No, I don't think so. It looks very little, but it's a very strong question. The kidneys are retroperitoneal. The ureters connect the kidneys to the urinary bladder. The urethra of a male is longer than the urethra of females. The kidneys are at equal heights within the pelvic inlet. The right kidney is located more inferiorly than the left kidney. Which of the following is not true? It's not true. It's not true. It's not true. Oh, okay. Thank you. Which one is not true? Meaning that all of them are true apart from one. Which one is not true, guys? Yes, D. The kidneys are at equal height within the pelvic cavity. It's not true. In a life, let me see if you remember some of the functions of the kidney in the abdominal cavity. So D would not be true. Yeah, yes, and also they are not at equal height. So you are still very correct. Yes, you are very correct. Look at this question. In life-threatening starvation, the kidney synthesize glucose by what? Synthesize glucose by what? Let me put the equation here. Secreting erythropoietin, secreting renin, deaminating amino acids, contributing to calcium homeostasis, production of uric acid. What's the answer, guys? In a severe starvation, what's the answer? Quickly, guys. Come on, guys. Come on, come on. Where is the energy? And yes, the answer is amino acid, deaminating amino acid. It can be secretion of renin. Renin is for blood pressure. It can be erythropoietin, that's for blood. It can be calcium homeostasis, that's for calcium. It can be producing uric acid. That's metabolism of nucleic acid. So it left us with deaminating of amino acids, which is correct. All right, and that's gluconeogenesis. Uh, okay. I've asked about hypocalcemia. Just a moment. Anything? Fear the dash. Okay, look at this question. Potassium enters the cell from interstitial via. Look at this question. I don't know if I should ask this question, but still look at it. Look at the options. Sodium potassium pump, countercurrent multiplier, countercurrent exchange, vasaracta, and justa medullary apparatus. Quickly, guys. Okay, guys, the answer is A. But before we continue, I just wanted to create give you a distinction between the countercurrent multiplier and the countercurrent exchange. Countercurrent multiplier, you understand, is just the active process, right, that creates and maintains osmotic gradients in the interstitial fluid of the renal medulla. That's why there is a lot of salt in the renal medulla. All right, that's countercurrent multiplier. But countercurrent exchange is different. This one is purely passive. The other one is countercurrent multiplier is active. Countercurrent exchange is passive, purely passive process, and it occurs in the medullary capillaries. Its purpose is to provide oxygen and nutrients to the tissue of the renal wall medulla without washing away the osmotic gradients created by the countercurrent multiplier. So the countercurrent exchange deals with supplying of oxygen and what? Nutrients to the renal medulla. But the countercurrent multiplier, it deals with creating what? Steep osmotic what? Gradient, high salt volume in the medulla. Remember these two things because they will ask you a question on it. If you don't remember it, go back and watch this video. And yes, the answer is A, guys. Sodium potassium pump. Very active pump. So look at this question. Exactly what I was just explaining. Look at this question very fast. Fastest finger. Look at the options. Is A, B, C, D, and E. Loop diuretics reduce body water content by acting on the. How do they reduce water? Quickly, guys, quickly. This is loop diuretics. This is something you see in the clinic every day. You know what loop diuretic is? That's furosemide, you know, bumetanide, all those things. Those are loop diuretics. Quickly, guys. Yes, the answer is, let me see what everybody's picking. The answer is the answer is B, guys. B is the countercurrent multiplier system. Countercurrent exchange, I told you, it just does with oxygen and nutrients. Loop diuretics does not do with oxygen and nutrients. It does with what? With stopping iron. Do you understand? Stopping iron from entering the blood. You understand? It blocks that iron entering the blood. All this sodium, potassium, chlorine, it blocks them from entering the blood. You understand? So when it blocks them from entering the blood, what will happen? Water, all of them will be inside the urinary tube and they will drag water with them. Normally, they are supposed to be reabsorption into the blood, right? How is this reabsorbed into the blood? They move from the tubule into the blood, especially in the ascending limb. That's where the loop diuretic works. So the loop diuretics will avoid that reabsorption of ions. So those ions, the sodium, potassium, chlorine, they will remain inside the tube. When they remain inside the tube, they will drag water with them. That's why we give you loop diuretics, because it drags water out of the blood into the loop. Do you understand? And you urinate a lot. If they give you loop diuretics, you keep urinating and urinating. So that particular thing is called what? Countercurrent multiplier system. The answer is B. The answer is B. Countercurrent what? Multiplier system, not exchanger. Multiplier. Countercurrent, I've told you, exchanger has to deal with nutrient and oxygen, but multiplier has to deal with salts. And where salt goes, water follows it. Loop diuretics does not allow salt enter the blood. Instead, it inhibits the salt from leaving the loop and entering the blood. Do you understand? So that's what loop diuretic does. Okay. So the answer is countercurrent multiplier. Don't mistake multiplier from exchange. Exchanger. Exchanger has to do with nutrients. All right. And that loop diuretics that they give in the clinic, it works on the ascending. Remember, the ascending loop, the ascending, that thick ascending, that is where there's a reabsorption of potassium, chlorine, sodium. So it works, it blocks that exchange, that particular reabsorption. There's a pump there, so that potassium, sodium, potassium chloride, ports. There's a pump there. So it blocks that pump. That's how loop works. That medication that they give you every day, that's how it works. So remember that, all right? Yeah, that thing is called sodium, chlorine, potassium co-transport. You understand? Co-transport. The three of them are leaving the tube into the blood. So water follows them. So to stop that, do you understand? That place is blocked. Okay. I don't want to take too much time explaining this thing. Where does aldosterone act? Yes, the answer is B. Where does aldosterone act? Aldosterone acts on the dash. Quickly. Which part of the tube does it act? Proximal convoluted tubule, medullary portion of the collecting duct, descending limb of nephron loop, distal convoluted tubule, and glomerulus. Look at the option now. Quickly, guys. Quickly, guys. Yes, the answer is D. Distal convoluted tubule. Yeah. Look at this question. It's giveaway. I want to round up this urinary system, but at least, even if we don't finish, at least you know that, okay, there is a system you have in your hand. You understand the point? Urinary system is very important. It's one of the most important systems because you see it in the clinic every day. It has a lot of medications working in it. Look at this question, guys. The urine is most likely to be hypotonic when they dash. This one is very straightforward now. When do you when does your urine when is it very colorless? Like, I don't know how to explain it. I wanted to explain the question for you, but no need. You guys know when your urine is very concentrated now. So when it lacks concentration, what do you think you do when that will make it like high concentration of solute. Yes, the answer is A. When you drink a lot of water, or when the body's water volume is high. That's the answer. Yes. Okay, this one is a giveaway. Trying to round this up. This is a giveaway. Seems still some. Normal urine from a healthy person should not contain. We have creatinine, we have urobilin, we have glucose, we have ammonia, we have magnesium. Creatinine, urobilin, glucose, ammonia, magnesium. Normal urine from a healthy person should not contain gluc- glucose. Who else? Yes, the answer is glucose. Perfect. Please wake up, wake up, wake up. I'm almost done with this. The pigment responsible for the color of urine is called what? What's the name of the pigment, guys? Monochrome, urochrome, cyanochrome, multichrome, and pyuria. What do you going to choose pyuria in the exam? Quickly now, what's the answer? Oh, Jesus. What's happening now? You don't see it. It's on the screen now, except if your stuff is lagging. Yes, the answer is B, urochrome. All right. Look at this question, guys. Look at this question, guys. Breakdown of hemoglobin. Yeah, 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 yeah. Yes. At the end of the day, it's urochrome. Okay, guys. A patient enters the hospital after a motorcycle accident. He complains of the mad back pain. X-rays reveal both ribs and pelvic fractures. Eh, his emergency room examination includes urinalysis. Which of the following findings from the urinalysis will most likely suggest trauma to the kidneys from the accident, but not to the urinary bladder? Let me give you the options. Look at the options here. Pyuria, hematuria, albuminuria, uremia, phenylketonuria. Quickly, guys. Come on, guys. Come on, come on, come on. Only 4 people in this class. Yes, everybody. There are 25 people. If you don't know it, you say you don't know it. Emergency 911 so that I can explain. Because if you don't talk, people get it and move on. Okay, guys. So first of all, I will start with the answer is C, albuminuria. You understand? So pay attention. This is why. You have to pay attention once and for all. Yes. The answer is what? Albumin in the urine. Why? Ask yourself, why? Because it is only in the kidney area that albumin is filtered. Albumin is not filtered in the ureter. So if somebody injures the ureter, for example, albumin, even if the ureter is open like this, albumin cannot enter because the ureter does not filter albumin. The place that filters albumin is the kidney. That parenchyma, anything that can break the parenchyma of the kidney, you understand, albumin will be able to pass through. You need to think about it. You understand? You need to. So if there is only $100 bill in this house, only this place you can find $100 bill, right? But in you can also see $10 bill in this house. But in the other room over there, you see $10 bills only. Now, what does it tell you? If it tells you that if you see $10 bills outside this house, it can either be from that room or from this room, right? So you are not sure which room it is from. But if you see $100 bill outside, you are sure it is this room because it is only this room that has done $100 bill. That's how I want you to think about it. Albumin is only filtered in the kidney. So it is only with the kidney issue that will lead to albumin leaking into the urine. So if you see albumin in the urine, it is kidney. So if somebody has a blunt trauma, you understand, from at the back, blunt force, maybe the thing ruptures the kidney and albumin will be, you see albumin in the urine. So that's how I need you to think about it. Somebody will tell me, oh, what of blood? What of hematuria? Well, hematuria is a good option. But as I told you, hematuria is like that $10 bill. You can see hematuria in the other room. You can see hematuria in this room. So if the ureter is injured, you will see hematuria. If the kidney is injured, you can still see hematuria. So you don't know exactly. So the hematuria is not a direct. If you look at the question, they said, which of the following findings from the analysis would most likely suggest trauma to the kidney? Now you understand, perfect. So hematuria can either be trauma to the kidney, trauma to the bladder, you understand, trauma to the ureter. It can be any of them. But albuminuria is definitely only the kidney. All right? Pyuria is just an infection. You understand? Urinary tract infection or inflammation process. And uremia. Uremia is just a systemic clinical syndrome that occurs when waste products like urea build up in the blood. That's uremia. That's usually severe kidney failure. That is kidney or severe kidney or chronic, severe acute or chronic kidney failure. Usually lead to what? Accumulation of a lot of waste urea in the blood, leading to uremia. Then phenylketonuria is an inherited genetic metabolic disorder, right? Where the body cannot break down what amino acid to form what amino acid phenylalanine. That's specifically phenylalanine. Don't worry, you guys will learn this in pathology. All right, maybe I'll teach you pathology. I don't know, but I need you to know the albuminuria difference with the hematuria. How that is the answer. I hope you guys are clear. So the answer to that question is what? Albuminuria. Okay, I think this might be the last question I will have to ask you. This thing is so important in the clinic. Clear, thank you. Thank you so much. Which to Sinatra, you said 911. Are you clear now? Are you clear now, Sinatra? Sinatra is no longer here. Okay. So which two substances are most useful for determining a patient's glomerular filtration rate? Which one? Two. Okay, you are clear now. Perfect. Which two substances are most useful for determining a patient's glomerular filtration rate? Yes, the answer is inulin and creatinine. Inulin and what? Creatinine. Usually we use creatinine now. That's why I told you in the clinic we do SEUCR, sodium electrolyte urea, what? Creatinine. Because the body breaks down creatinine and removes it by itself. But inulin, the body doesn't produce inulin. Instead, we inject inulin inside you, and the kidney has to remove inulin 100%. Inulin is actually better to check than creatinine. If I see any inulin in your body after injecting it in your body over a period of time, I will know that your kidney is bad, right? But it's invasive. Me injecting something into it is invasive. So instead, we use the one that the body produces naturally, which is creatinine. So that's why you hardly hear inulin. But inulin and creatinine is the gold standard. Please prepare for this question, this diagram, all right? This diagram, they'll be asking you which in which of these structures is the trisomy muscle found. They'll be asking you, yeah, in which of these structures is the trisomy muscle found? They'll be asking you, which of these structures does urine move through peristalsis? They will be asking you, in which of these structures is urothelium found? Okay, those are the major questions they will ask you from this for your lab. Let me see if there is something that you need to. Yes, and this is another diagram. This is another diagram, guys. I don't know if you can see it properly. Very important diagram that you must study. They will be asking you questions like, through which of these structures does urine travel? You understand? Through which of these structures does urine travel? Guys, which one? Tell me, what is the answer to this question? Through which of these structures does urine travel? Let me see if somebody will get it right. Which one is the answer? Quickly. I'm listening. Hmm? How can you say C or E? No, now look at the diagram. Let me give you guys the simple. Somebody say ED. People are beginning to think. I think you guys need to take some glucose so that you'll be able to reason out this thing properly. What did I tell you about this thing? I told you that all this place is tubular fluid, tubular fluid. Then the urine begins in this yellow part. Yellow, all this yellow part is urine. That's why it's yellow like this in the diagram. That's the yellow part. Did you notice what I'm doing? Yellow parts. All of them is where the urine passes through. Is it not CDE? Does urine not pass in minor calyx? Does it not pass in major calyx? Does it not pass in pelvis? If they even put F here and put F here, that's the ureter. It will still be part of it. The answer is CDE, guys. And trust me, ED is in the option. Trust me, C is in the option. E is in the option. They want you to fail it. You have to think like like a scientist, eh? So that you'll be able to get these questions correctly. They will ask you what is the name of C. Everybody knows C already. They will ask you what is the name of E. Just know the name of all those diagrams there, right? You can't see my mouse? Really? You can't see my mouse? I thought you can. Oh, they really cannot see my mouse. Sorry. Can you see the mouse now? Let me. Oh, you can see the mouse now. Okay, look at it now. All these yellow parts. Yes. All these yellow parts is where urine passes, all right? Okay. So let me put this other diagram. Look at this diagram. If they answer this diagram, you cannot fail it too. You understand? They will ask you which vessel is arcuate artery. Guys, which one is arcuate from the diagram? A, B, C, D, E. Quickly. Which one is arcuate? A, B, C, D, E. A, B, C, D, E. I thought a lot of people will be picking the answer already. Okay, so they will ask you, you have to name all those places. Yes, the answer is B. Look at this diagram. You see why urinary system is so important. Oh, sorry. Hold on. Look at this diagram. Reabsorption. Most water. Where is most water reabsorbed? Guys, where is most water reabsorbed? Oh. Where is most water reabsorbed? A, B, C, D, E, F. A, B, C, D, E, F. You have to pick answer from here, not from. I know it's proximal, but which one is proximal? That's how you need to. A, B, C, D, E, F. B. The answer is B. Yes, the answer is B. That means somebody here doesn't know proximal. The answer is B. Which region of the nephron is permeable to water but not sodium chloride? Which one is permeable to water but not sodium chloride? Remember, this filtration here, this reabsorption. So this place, more water is entering here. You understand? Reabsorb. More water is going out from here, rather. This is too. More water is going out from here. Do you understand? And salt. But what they're asking you now is which region of the nephron is permeable to water, but not sodium chloride? Permeable to water, but not sodium chloride. Remember this C. The answer is C. That's this thin descending loop. This is where it's permeable to only water, but not sodium chloride. That is why it is simple squamous. You have to remember, very important. I've already given this question before. Antidiuretic hormone targets which region of the tubule? For people that were listening, what's the answer from this diagram? A, B, C, D, E, F. Where does I told you we have all these furosemide acts. What are diuretics? You understand? I told you that they act here. This ascending parts, this ascending loop, that's where they act. But ADH, where does it act? Quickly, guys. No, ADH doesn't act here. No. This is DCT. ADH doesn't act in DCT. I mentioned it. We asked a question on it. Nobody? Perfect. It happens in the collecting duct, F. This is where ADH works. You understand? This is where ADH works. It stops, everything that happens. This is where ADH works, in the collecting duct. Collecting duct, all right? Okay. Let me see. Okay. Guys, that's it for urinary system. I think you are very fortified now for urinary system. Anybody has a question for me? I think we will only be able to take one system. So choose one. One of the other two chapters. Choose one. Choose one quickly. Which one? Oh. It's either blood vessels or lymph. We have to take just one because I have to get off by 10. You don't find video on my channel? How? Listen, there are two things you can do on my channel. Either you go to the video section or you go to the live section. Like this thing now we are doing will be on the live section. And I've done it with some other classes. So you can actually see this and see the same question. You understand? It's just your ability to remember these questions, to study them over and over and over and over and repeatedly. Some people will get 100 in the exam. Some people will get, you still fail it. That's the problem, no matter what I do. Yeah, so for circulatory, don't just watch only the video. Also go and look for the live and look at it. All right. Also check the live, please. Okay. Let's see. So all of you agree in lymphatic system. Okay, so let's go to lymphatic system. So everybody will go the circulatory system, please. The video is there. Life is there. The video is there. The life is there. Please. All of them will have equal questions. So don't neglect anything. Okay. True or false? Let's do true or false quickly. In 15 minutes. True or false? Fastest finger. True or false? Answer. The lymphoid system is involved in fluid recovery. immune surveillance, and lipid absorption. True or false? True. Answer true. Answer true. I'll be moving very fast. Red bone marrow is where all immune, yes, true. Red bone marrow is where all immune cells of the lymphoid system originates. True or false? The answer is true. It's still true, all right? The answer is true. Look at this one. Lymph originates in blood capillaries that pick up tissue fluids. True or false? Lymph originates in blood capillaries that pick up tissue fluid. True or false? The other two questions, the lymphoid system is involved in fluid recovery, immune system, and surveillance. That is true. The red bone marrow is where all immune cells of the lymphoid system originate. The answer is still true. Lymph originates in the blood capillaries that pick up tissue fluid. The answer is false. Lymph originates in blood capillaries that pick up. No. The answer is false. The answer is false, guys. Look at this question. A pathogen is a disease-causing microbe. True or false? Lymph originates in blood capillaries that pick up tissue fluid. False. Look at this question. A pathogen is a disease-causing microbe. True or false? A pathogen is a disease-causing microbe. True or false? True. The answer is true, guys. True. The answer is true. A pathogen is a disease-causing microbe. The answer is true. You have to be very fast with me right now. Like I'm speeding because, no time. I'm speeding. The immune system spans nearly every organ and tissue in the human body. The immune system spans nearly every organ and tissue in the human body. True or false? True or false, guys? The immune system spans nearly every organ and tissue in the body. True or false? Yes, the answer is true. Look at this question. Mucous membranes prevents most pathogens from entering the body because of the stickiness of the mucus and the presence of lysosome. True or false? True or false? Okay, the answer is true. True. Yes, the answer is true. Look at this question. Adaptive immunity involves macrophages, antibodies, and interleukin. True or false? Adaptive immunity involves macrophages, antibodies, and interleukin. True or false? The answer is true. The answer is true. Capital true. Look at this question. Interferons are secreted in response to bacterial infections. True or false? Interferons are secreted in response to bacterial infections. True or false? Is it bacterial infections, guys? False. The answer is viruses. Do you understand? It's actually interferons is secreted for viruses, not bacteria. So the answer is false. The answer is false. Okay, the answer is false, guys. It's false. It's false. Look at this question. Pyrogens act by increasing the set point for body temperature in the thalamus. Pyrogens act by increasing the set points for temperature, set point for body temperature in the thalamus. Answer. True or false? True or false, guys? The answer is false. It is not in the thalamus. Instead, it's in the hypothalamus. It's in the hypothalamus, not the thalamus, guys. I like how fast we are now. Like, it is for people that have studied. You need to study for you to join my session. You can't just come here without studying, all right? The answer is false there. So pus is made of dead neutrophils, macrophages, and other tissue debris from a damaged tissue. True or false? Pus is made of dead neutrophils, macrophages, and other tissue debris from a damaged tissue. True or false? Yes, the answer is true. You guys are so correct. The answer is true. It's true. Look at this one. Humoral immunity takes care of intracellular viruses, whereas cellular immunity takes care of extracellular viruses. True or false? Humoral immunity takes care of intracellular viruses. Somebody say you cannot type. If you cannot type, you need to log in to the YouTube stuff. I don't know how they do it, but sometimes some people have that problem and later they log in. Yeah, the answer is false. And why is it false? The statement is reversed. Humoral immunity targets extracellular pathogens, including viruses free in the blood or tissue. Whereas cellular, cell, inside the cell, you understand, cell mediated, it targets what? Intracellular, intracellular, inside the cell. Feel me? Yeah. Including viruses that have already invaded and hidden inside host cells. So it's actually, that question is reversed. That's why the answer is false. So you need to remember it, because they can tell you, oh, cellular immunity takes care of intracellular. Humoral immunity takes care of extracellular. That one will become true. So you need to know why it is false, not just knowing that it is false. Okay. Clear. Perfect. The antigenicity of a molecule is due to a specific regions of it called haptens. True or false? True or false? The antigenicity. True or false? True or false? We know what antigenicity is, right? That's the ability to be recognized and bound by the immune system. And it is because of what? Epitopes, not haptens, guys. Epitopes. You understand? Haptens are just things that are too small. It's very, very small, simple molecule that possesses reactivity but lacks what? Immunogenicity on its own. It cannot act on its own. It has to combine with the system. You understand? Sometimes the immune system will completely fail to, recognize it at all because it's too small. An example is penicillin, even poison IV, and some certain medications. They are called what? Haptens. But epitope, is antigenicity determinant. So epitope determines antigenicity, not haptens. So that answer is what? False, because they say the antigenicity of a molecule is due to specific regions of it called haptens. That answer is false. But if they say antigenicity of a molecule is due to specific regions of it called epitopes, answer true. You feel me? Okay. Yes, the answer is false. I don't know why somebody is catching cold. Naive T cells can synthesize antibodies. True or false? Naive T cells can synthesize antibody. True or false? Hmm? Can T cells even synthesize antibody? This one, because they put it naive. Somebody is thinking too much. Can T cells, whether it is naive, whether it is helper, whether it's cytotoxic, can it synthesize antibodies? What produces antibodies? Is B cells. You understand? I remember I told you B cells, they differentiate or they differentiate into plasma cells. Plasma cells produces what? Antibody. So B cells synthesizing antibody, it has nothing to do with T. Do you understand? So they just put naive there for you to think too much. So the answer is here, false. T cells cannot synthesize antibody, whether naive or cytotoxic or helper. All right. So look at this. Clonal selection of T cells happens in the thymus. True or false? Clonal selection of the T cells happens in the thymus. True or false? Quickly, my people. Yes, the answer is what? False. Why? Clonal selection happens where in the secondary lymphoid organs, all right, not the thymus. Example like lymph nodes, spleens, and tonsils. Those are where the T cells clonal selection happens. You understand? Thymus is just for its maturation. Remember that. No time. I'm beginning to like this true or false questions because it's very, very straightforward. Look at this. Interleukins are chemical signals by which immune cells communicate with each other. True or false? True or false? Somebody say. Okay, guys, the answer is true. Think of the name. Like if you even reason the name, everybody 911. Guys, interleukins are a major class of cytokines, right? Right? Cytokines are signaling proteins. Signaling proteins. Very, very important that you know it. Even the reason the name interleukins, that's in between interleukocytes. Interleukin is leukocytes. What is leukocytes? White blood cells. So it's like an intercom between white blood cells. Do you understand? Like how that's how you discuss it. You think about it. So it's between what does intercom do? Signal between here and here. Do you understand? So the answer is true. It's a chemical signal by which immune cells communicate with each other. All right. The answer is true. Clear. Perfect. Look at this. Helper T cells respond only to epitopes attached to MHC proteins. True or false? Quickly, guys. Helper T cells responds to only epitopes attached to MHC proteins. The answer is true. The answer is true. Guys, you need to know something. The helper T cells, that's the CD4 cells, they are blind to free-floating native antigens. They are blind to them. So for helper T cell, that's CD4, right? For them to recognize and respond to a foreign antigen, that antigen must have been processed and physically presented to them. And what is it that presents it to them? That's what we call what? MHC, major histocompatibility complex. Do you understand? So there's something we call the APC, antigen presenting complex, right? They engulfs a pathogen. So if this is a pathogen now, they will engulf this pathogen. You understand? They engulf it and swallow it. Now, this pathogen enters my body now. The pathogen is digested inside a lysosome. Then this lysosome is now broken up into what? Epitopes. So these epitopes, I carry this epitope and put on top the what? Major this is MHC. So it is until these epitopes are on this MHC that helper T cell will see them and say, oh, let me destroy them. You understand? Let me destroy them. They are crushed by helper T cells. You need to understand it. This guy is a foreign antigen. It enters the system. Helper CD4 will not see it. CD4 cannot see it. So what will happen is APC, antigen presenting cell, we carry it like this and swallow it. Inside I'm the APC. Inside me, there is lysosome. The lysosome will break up this guy into epitopes. Remember what I told you epitopes are? Epitopes are, they have multigenicity. So they break it up into epitopes. When it breaks it up into epitopes, it will carry it and put on something we call what? MHC. Think of MHC like a carrier. So this MHC will now carry this thing and come out to the cell surface. CD4 we see it and say, oh, there is an epitope. There is a foreign material in form of epitope on MHC. Remember, APC was what gave these epitopes to what? MHC. So think about it. That's how, if you don't understand the concept, you can always go back, all right? Yeah. So helper T cells respond only to epitopes attached to what? MHC proteins. The answer is true. Same thing with cytotoxic T cells. Same thing with remember the first one I talked about what? Helper T cells. Same thing with cytotoxic T cells, that's CD8. They also respond only to antigens bound to MHC proteins. Antigens bound to MHC proteins. Helper T cells responds only to epitopes bound to MHC proteins. Helper T cells, epitopes. Cytotoxic T cells, antigens. But all of them has to be bound on what? MHC protein. Okay. Perfect. Look at this question. Yes, that answer is true. So look at this question. Cytotoxic T cells degrade after coming in contact with an infected cell. True or false? True or false? True or false? Only one person. The answer is false, guys. The answer is false. It doesn't to kill it and still be alive. It's not suicidal. Most memory B cells are found circulating in the lymph. True or false? Yes, that answer is false. So most memory cells are found circulating in the lymph. True or false? Yes, the answer is false. They are not really found just in the lymph. They are found in lymphoid organs like spleen, lymph node, MALT, that's mucosa associated lymphatic tissue in the tonsils. All right, that's where they are found. They are not found in the circulating the lymph. So the answer is false. Look at this question. Antibodies and complements can work together, linking innate and adaptive immunity. True or false? Yes. Oh, somebody said, yeah, antibodies and complements, they work together now. What's confusing you? They actually work together now. That's what the immune system is about. You understand? The interaction between antibodies and complement system is, it's how adaptive immunity works. Eh? You understand? They directly recruit and activate innate immune system. It's more shared destructive outcome. That's where you see things like opsonization, inflammation, and direct lysis, MAC. All right? The answer is true. Humoral immunity. Let me see. Humoral immunity produces memory by increasing the number of cells and antibodies that can fight off a pathogen in the secondary response. True or false? Yes, the answer is true. This one is very straightforward now. The answer is true. Cellular immunity. Look at this question. Cellular immunity uses B cells and humoral immunity uses antibodies. True or false? True or false? True or false? No. No, the answer is false, guys. The answer is false. All right. It's just half correct. Cellular immunity uses T cells, while humoral immunity uses B cells to produce antibodies. You understand? Cellular immunity uses what? T cells. Cellular uses T cells, not B cells. Do you understand? Why humoral uses what? B cells to produce what? Antibodies. So that humoral part is correct, but the cellular part is wrong. That's why the answer is what? Wrong. The answer is false. All right. Okay, this one, I'm not sure you guys will know this one, but let's try. Let me see if one or two. Just attempt it. Cellular immunity uses MHC1 and MHC2, but humoral immunity uses only MHC2. True or false? Somebody say, oh God. The answer is true. I don't want to take a lot of time explaining it. Just know that the answer is true. Cellular immunity uses MH1 and 2. Humoral uses only MHC2. And the little distinction you need to know about humoral and cellular now is that remember that humoral immunity uses B lymphocytes. No clue, that's fine. Just know it. Remember that humoral immunity uses B lymphocytes, that's B cells, and their primary weapon is antibodies. All right. Uh-huh. And what do they fight? Their target location is usually extracellular pathogens that are flowing in the blood, lymph, or tissue fluids. But when you're talking about cellular immunity, that's cellular mediated, cell mediated immunity. It's always what T lymphocytes, that's T cells, and cytotoxic, and they use what their primary weapon is. The other one uses antibody, that's humoral, but cell mediated uses what cytotoxic T cells, that's CD8, and cytokines. And they target more cell mediated, target intracellular. You understand? That's pathogen inside the host cells, like viruses, right? So remember that. And also, you need to remember from that last question I asked you, you need to remember that cellular immunity uses what? MHC1, major histocompatibility 1 and 2. But humoral only uses what? 2. You understand? You guys remember what MHC is? I've already explained it when I told you about the pathogen. APC swallows the pathogen, breaks it into epitopes, and gives it to MHC to carry. You understand? MHC will now carry it to CD4 and to CD8. It's as simple as that. You understand? So there's two types of MHC. There's MHC1. There are many types, but specifically there's MHC1 and MHC2. You understand? And we say that cellular, you understand, uses MHC1 and MHC what? 2. But humoral only uses MHC2. Remember that, guys. No, it's not last question for true of us. So the second to the last question for true of us, I'm trying to exhaust all the true of us so that anyhow they give you true or false, you'll be able to know it. An allergic reaction is a form of hypersensitivity. True or false? An allergic reaction is a form of hyposensitivity. They just want to confuse you because they even almost confused me. That thing is hyposensitivity. Did you see? Hypo, not hyper. The answer is what? False. Please pay attention. No? An allergic reaction is actually a form of hypersensitivity, not hyposensitivity. Hyposensitivity is talking about when your immune system is low. Do you understand? That's hyposensitivity. When your immune system is what? It's low. That's immunodeficiency state. That's hyposensitivity. Oh my God, false. Yes, the answer is false. Don't worry. You were not alone. They also caught me. Has this soccer started today? Let me see. Oh, it has started. That's where I will see Michael. I've not seen Michael since. Piam soccer. Michael came out. Michael, you need Jesus Christ. Adult version. Hold on. I'm trying to see if I can put it so that if you are wasting time answering questions, I'll be watching soccer. Argentina has scored 1 goal. Interesting. Okay, where are we? An allergic reaction is it's a hypersensitivity, not hypersensitivity. Okay, the last question for true or false. Last question for true or false. Ghana is playing tomorrow. I'll definitely see it. See the last question for true or false. Some antibodies against foreign antigens can react to similar self-antigens, causing an autoimmune disease. True or false? Yes, the answer is true. Okay. Okay, yes, the answer is true. That's for the true or false. About 25 of them I just discussed with you. Oh boy. This one is small, too. Oh boy. Hi, please. I need you guys to. You guys should do me a favor. No, the answer is true, not false. You guys should do me a favor. You need to answer very fast, all right, so that I can touch all these questions and satisfy myself before I leave you. You know, the problem I have most times when I'm not satisfied that, I've given you the best I could, I feel somehow. Do you understand? I feel terrible. You understand? These 2 topics, at least, if it is these 2 topics, I want you to make sure that you don't fail any question from me in both my exam and also the midterm. All right? That's why I want to fortify you in every way. You understand? Okay. Are we ready to go? Please. So you guys have to answer everybody. I want to see immediately. I put it 10 questions, 10 people, 10 people, 10 people. If you don't know it right, you don't know it. Please don't just keep quiet and be watching every other person. It doesn't help. All right. I need that urgency from you. Because if I don't see that urgency from you, I'll stop anyway and you still see those things. It's you that we have the issue, and I don't want you to have issues. You know me now. So look at this question, guys. Look at the options. Everybody should know that self without the options. Quickly, guys. Let's go. Water, glucose, vitamins, amino acids, and lipids. Special lymphoid vessels called lacteals absorb dietary dash that are not absorbed by the blood capillaries. Perfect. Answer lipid. I won't be wasting a whole lot of time. Remember, I told you guys, a nephron is 1.2 million. Let me just be singing it now. I know I didn't give a question on that, but that question always comes out. Okay, the answer to this is lipid. Lymphatic vessels recover about dash of the fluid filtered by the capillaries. How many percent? How many percent? We have 5%, 15%, 25%, 50%, and 85%. Answer. Lymphatic vessels recover about how many percent of the fluid filtered by the capillaries? Quickly, guys, quickly. You have to answer like you're in the exam hall. Answer 15. Perfect. Answer 15. Perfect. Perfection. Lymph is similar Lymph is similar to blood plasma, but very low in dash. Very low in dash. Protein, carbon dioxide. Look at the options quickly. Quickly. Why? What is happening? Very few people are answering now. Yes, the answer is protein. Now there are a lot of questions, so and you guys are slow. Okay, look at this question. Yes, the answer is protein, no, guys. The answer is protein, not electrolytes. It's protein. That's the difference between lymph and blood. Look at this question. The human immunodeficiency virus, HIV, targets mainly what? Targets mainly what? Option: helper T cells, B cells, plasma cells, cytotoxic T cells, natural killer cells. Quickly, guys. Quickly. Answer. People that has HIV, they say, oh, go and check their CD4. Go and check their CD4. CD4, is it helper T cells or cytotoxic T cells? Which one is it? Answer: helper T cells. Perfect. Perfecto. You understand? Perfecto. Look at this. Yes, helper T cells. Look at this. Autoimmune diseases. What are autoimmune diseases? If you know, you know. Autoimmune diseases are disorders in which the immune system fails to distinguish dash from foreign ones. Quickly, guys. Yes, the answer is C. Please, not A. The answer is C. Self-antigens. Autoimmune is attacking you. You understand? Your system is attacking itself. Just a moment. Let me see. Which is vaccination, cellular immunity. Which of these pulses also feels blood lacks capacity? Removal of dash. Okay. Look at this question. Sorry, I was taking a little time looking for some very specific questions. Look at this question. Lymphatic trunks collecting ducts, lymphatic trunks, subclavian arteries, lymphatic trunks, subclavian veins, collecting ducts, subclavian veins, collecting ducts, subclavian arteries. Dash are the largest lymphatic vessels and they empty into the dash. Quickly, guys, quickly. Somebody said trunk. There are two dash there. Quickly, guys. Guys, the answer is D. Only one person got it. The answer is D, collecting ducts, and they empty into the subclavian ducts, subclavian veins, not arteries, veins. Didn't you see it? You should know the circulation, how it moves. Lymphatic capillaries, that's the smallest vessels that absorb interstitial fluid from the tissues. Capillaries, where do they empty into? Capillaries, they empty into where? Converging capillaries, they empty into where? The lymphatic vessels. You understand? This passes through lymph nodes. You understand? Lymph nodes filter the fluid. Then from the lymphatic vessels into the trunks. So the union of the largest collecting vessels, you understand? They drain into the what? Trunks. And the trunks, like the lumbar, the interstitial, the bronchomediastinal, and others that we discussed. Now the trunks empty into where? The ducts. All right? And there are only two in the entire body, the two ducts. That's the big safety tank I told you. We have the thoracic duct and the right lymphatic duct. So this duct now enters into where? The subclavian veins. The thoracic duct empty into the to internal jugular and the left subclavian vein, while the right lymphatic duct empties into the right internal jugular and the right subclavian vein. So remember that. All right. So collecting ducts, subclavian ducts, largest lymphatic vessels is collecting ducts, emptying into what? The subclavian veins. You can't forget this. So very fast. I have very few minutes to go, guys. I have so many questions to discuss. Dash are found especially in the mucous membrane, standing guard against parasites and allergens. Quick one. Which one? If you do, somebody see this CBC, what will you see? And you say, oh, this person has a lot of parasites, or maybe this person has allergens. What will you see? Elevated. Monocytes, lymphocytes, basophils, neutrophils, eosinophils. Quickly. Yes, the answer is eosinophils. Yes, somebody say 911. The answer is actually eosinophils. Each of them has what they are standing guard against. Like neutrophils, they are most abundant white blood cells, right? They serve their major function, they respond against what? Bacteria and what? Fungal infections, bacterial and fungal infections. That's neutrophils. All right. Things like basophils. Basophils circulate the bloodstream, and they usually trigger allergic reactions. Rather than specializing in killing large worms with major basic proteins. Monocytes, I think monocytes, they help in phagocytizing cellular debris and bacteria. You understand? Because monocytes, they create what? Macrophages. Do you understand? Then lymphocytes, we have different categories: the B cells, the T cells, the NK cells, which helps to destroy different things in the body. So the answer to that question is eosinophil. All right. Mm-hmm. Yeah, and this one is very special. Look at this question. DASH employs a respiratory bus to produce bactericidal chemicals such as hydrogen peroxide and hypochlorites. DASH uses this method. Which of them uses this method? Use the same options. Or let me change the options a bit. Which one? Uses a respiratory bus. Quickly, guys, quickly. Come on, I've already put the next question. Oh. Which one? Okay, neutrophils. Neutrophils uses respiratory bursts. Remember that. Look at the next question. Yes, neutrophils. Look at the next question, guys. Immune surveillance is a process in which DASH non-specifically detect and destroy foreign cells and diseased host cells. Which one? Which one, guys? Yes, neutrophils. That's for the first question. Respiratory burst, neutrophils. A is correct. But this other question, immune surveillance is a process in which DASH non-specifically detect and destroy foreign bodies and diseased host cells. Which one? Immune surveillance. Which one, guys? Yeah, so the answer is not D. The answer is E, natural killer cells, guys, NK cells. You need to understand immune surveillance. Right? When immune surveillance is just like a continuous patrolling process, where the immune system scans the body's tissues to detect and immediately destroy what? Foreign invaders. You understand? Virally infected cells and newly arising tumors that can multiply. So the primary drivers of immune surveillance is what? NK cells. It's just like if you are entering the ferry, you will see where you see metal detectors. Those detectors is what? Assuming those detectors are moving up and down, right? Detecting people that has metals like guns. That is what NK cells are. Do you understand? But macrophages does not is not immune surveillance. Macrophages is just like the maybe NYPD. Let's use NYPD. They don't. NYPD will not be surveilling whether you have gun or not. No, they can't detect that. Instead, if there is an issue, they catch you. They either deal with you or they take you to court. So they are more like APCs, right? So macrophages are APCs, antigen presenting what? Cells. All right. Yeah. So sometimes they destroy that antigen. They actually phagocytize that antigen. Macrophages and dendritic cells. Sometimes they engulf that foreign body pathogen, non-specifically, right? But their major role, their primary systemic role is to what? Process those pathogens and what? Present them to the adaptive immune system. So that adaptive immune system will now what? Destroy them. Remember, when I talked about presentation, APC, presenting, major MHC will now carry them. If you remember what I said. So immune surveillance, if you hear immune surveillance, please pick NK cells. So look at this option, this question. Perforins is released by what? Let me give options. Hold on. Look at the options here. So if they give you these options, perforins is released by. I agree, but look at this option. There are two things that releases perforin. One is NK cell, but NK cell is not in this option. What is the second one? Yes, the answer is D. CD8. That's cytotoxic T cells. That's CD8. Remember, CD4 is helper. CD8 is cytotoxic T cells. All right? Yes, the answer is D. Look at this question. Which of the following is common in distal small intestine? Distal. We have the aggregate lymphoid nodules. We have the MALT, that's the mucosa-associated lymphatic tissue. We have the lymphoid nodules. We have the macrophages, and we have the diffuse lymphoid tissue. Answer. Yes, cytotoxic T cells, that's CD8, and NK cells produces perforin. Remember that. Answer. Let's go with that pace. Let's go with that pace. Let's go with that pace, guys. What's happening? I've given the options now. Which of the following is common in distal intestine? Distal small intestine. They are just trying to confuse you. Okay, perfect. Not sure. That's good. The answer is what? Aggregated lymphoid nodules. That's A. So if you pick A, that's correct. Listen, when you talk about MALT, some people are saying mucosa-associated lymphoid tissue. When you talk about MALT, it's just an umbrella category, right? It encompasses all mucosa immune tissues throughout the entire body. You understand? So you can find MALT in respiratory tract, urinary tract, etc. So it's not specific to that particular part of the intestine. All right? Even diffuse lymphoid tissue is found in all parts of the GI tract. Do you understand? So what we are left with? We are left with what? Aggregated lymphoid nodules. That aggregated lymphoid nodules is what we call what? Peyer's patches. You must have heard Peyer's patches. Correct? You must have heard Peyer's patches in the distal small intestine. That is what? Aggregated lymphoid nodules. MALT is just everywhere. You understand? It's just an umbrella word. All right? I wanted to ask this question, but it's waste of time. So even if two people get it, I'll move. Look at this question. T cells achieve immunocompetence where? Where do they achieve immunocompetence? Competence. Bone marrow, spleen, blood stream, spleen, thymus, liver. Quickly. Another person. Thymus, yeah, thymus, correct. Look at this question. The Dash tonsils are the largest, and their surgical removal used to be one of the most common surgical procedures performed in children. Which one? Which tonsil do they remove most in children? We have adenoid, lingual, palatine, pharyngeal, nasopharyngeal. Which one? Yes, the answer to that other question, T cells achieve immunocompetence in the thymus, correct. So which tonsil, which tonsil is the largest tonsil in the body? Yes, the answer is palatine tonsil. If you choose C, you are correct. The answer is palatine. All right. Remember that too. Palatine, 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 palatine. You can't forget. This one, everybody knows this one now. Nobody can. No, it's not adenoid, it's palatine, all right? Look at this question. The dash shows you don't need to be removing anything. Just leave it. Leave the answer, right? It's okay to be wrong right now. Just learn it. Learn the right thing. You don't need to delete your answer. The dash shows remarkable degree of degeneration or involution with age. The dash. Which one shows degeneration with age, guys? Lymph nodes, thymus, spleen, pharyngeal, tonsils, appendix. Which one? Yes, the answer is what? Thymus. The answer is thymus. Look at this question. Yes, the answer is thymus. Look at this question, guys. What was the answer to this question? Removal of the dash would be more harmful to a 1-year-old child than an adult. Spleen, lymph node, thymus, appendix, palatine, tonsil. Yes, the answer is thymus. The answer is thymus. Look at this question. Which of the following does not belong to the second line of defense? Which one does not belong? Which of the following? So let me give you guys the option. The macrophage system, NK cells, inflammation, gastric juices, interferon, and the complement system. Which one? Yes. That's why Afua thymus, Afua T. Yes, that's the. I can't hear. Is there another person that can't hear me? Who? Is there? Everybody can hear me? Am I frozen? No, I'm not frozen. Can you guys hear me? Frankie, can you hear me? Yes, we can hear you. Okay, so it's from that person. So the answer to this question is what? Yes, you can hear me. Okay. So which of the following does not belong to the second line of defense, guys? Perfect. Which one? Quickly, guys. Quickly. Yes, D. The answer is D. Gastric juice. Yes, the odd one out. Okay. Look at this question. Yes, D. Look at this question. Dash lacks the capacity to remember a pathogen or reacts differently to it in the future, whereas Dash utilizes memory cells to adapt to a given pathogen and ward it off more easily in the future. Seems you guys just came alive right now. That's good. I know because you don't want me to stop at 10. But the Lord is my shepherd. Gonna stop at 10. That's why you are coming alive by this time. I know your plan. Look at the option. Okay. So what is the answer, guys? A, B, C, D, E. A, innate immunity cytotoxicity. B, adaptive immunity, innate immunity. C, a natural killer cell, macrophage. D, innate immunity, adaptive immunity. Natural immunity, artificial immunity. Which one? I know now because immediately it's 10. Man, I start seeing a lot of people typing. But before it was just 4 people. Mm-hmm. I know now. I know your. Is it today that I've been with students? I know you people are there. Some people. Michael was busy watching soccer. Immediately, but Michael is back answering. He's not even here yet. Okay, guys. What's the answer, guys? He said the kids are sleeping. He said, well, you don't want me to go. Please wait first, Yolet. Let's concentrate. Okay, guys. The answer is A, B, C, D. The answer is D, innate immunity and adaptive immunity. They say dash lacks the capacity to remember a pathogen or react differently to it in the future. That's innate. But adaptive will remember. So if you just see that memory, you know it's adaptive. It's very straightforward.
You are correct to be skeptical.
Quiet. My phone is always talking. My phone is always talking. Is D not the B? They said adaptive. Adaptive, it can remember. You understand? They said dash lacks the ability, capacity to remember. It lacks. That means it doesn't remember. You know, that's innate. Then the second part says dash can remember. That's adaptive. It's very straightforward. Yes, innate adaptive. Don't let them confuse you, please. Look at the questions very well before you pick. Don't let them confuse you, guys. I'll be very sad if you fail simple something that you see. These 2 topics is what you use to buffer your score. You understand? Buffer as far as you are participating very actively here, you'll be able to remember. If you go, please, when you finish, go and revise the video. Don't just think, oh, because you were part of this, oh, that's fair, that's it. No, you go and look at the video over and over. You know, and that's what we call consolidation. You feel me? That's consolidation. You have to consolidate. Frankie, stop crying. Hey, okay, look at this question, guys. One group of proteolytic enzyme created by natural killer cell is what? Options. Selectin, cytokines, granzymes, perforins, interferons. Perfectly. The answer is granzymes. And there's another question that says, when an enemy cell is present, a dash secretes perforin. NK cells. All right? So remember, NK cells gives perforin. Also cytotoxic T cells. But they hardly ask cytotoxic cells for this particular question. So remember, granzymes is a proteolytic enzyme secreted by natural killer cells. All right? Look at this question. Look at this question, guys. Give me a very sharp response. Huh? A, B, C, D, and E. Quickly. I think I have ADHD, always reading fast. No, it's good to read fast, but please understand the question, pick the answer. All right? It's good to be fast, but don't be fast at your own detriment. All right? What's the answer? The answer is neutrophils and macrophages and opsonization. The answer is E. Complement C3b protein coats bacteria and stimulate the phagocytes by neutrophils and macrophages during the process called opsonization. I hope you understand that. The answer is E. Everybody got it, so that's fine. Look at this. Dash are secreted by cells infected with viruses, alerting neighboring cells and protecting them from becoming infected. I mentioned this thing. I said it. I was singing it in class. I said it's like a bell. Do you remember when I was saying, oh, it looks like a bell? Bagam, bagam. Everybody hide in your house, so that they will not catch you. What does that? Is it a complement system? Is it globulins? Is it interferons? Is it granzymes? Is it pyrogens? Is it perforins? Antoinette, I guess you are still on the other question. And E is correct for that question. That's complement C3b protein coats bacteria and stimulates phagocytosis. Phagocytosis. What phagocytizes? Right? So I guess that's where you are. Things that phagocytizes are neutrophils and macrophages. All right. And what is the process? Process is opsonization. So here we are asking about the cells that rings the bell to one or every other person. Yes, the answer is what? B, not C. Somebody said C? No, it's not C. C is granzymes. Granzymes is just something that is produced by NK cells. All right. But this one is interferon. Interferon is the what rings bell. Everybody hide though. There is an enemy in town. Everybody go and hide though. The answer is interferons. All right. Yeah. The interferons is C. Yes. Look at this question. Very fast, guys. Dash are antimicrobial proteins. Dash, which of the following is an antimicrobial protein? Which one? Which one? Quickly. Which one? Oh, why are we taking this? You guys are suddenly getting quiet. I'm leaving in the next 10 minutes. Oh, I didn't give options. Sorry. No, hold on. Antimicrobial. Oh, yeah. I think I gave options. I gave the options. Yes, the answer is interferon. The answer is interferon. Yes. The answer is interferon. Then look at this question. Yeah, interferon. Look at this question. Endogenous pyrogens are produced by, what is produced endogenously that causes you a hot temperature? Endogenous pyrogens are produced by what and what? Or by what, sorry. We have bacteria, we have mast cells, we have neutrophils and macrophages, we have plasma cells, and we have viruses. Which one? Endogenous pyrogens. So, guys, you guys need to understand two things. There are two types of pyrogens. Pyrogens are usually things that causes fever. There are two types of pyrogen. We have exogenous. The exogenous are foreign substances that originating outside the body. You understand, such as bacteria, viruses, bacteria endotoxins like liposaccharide, LPS, right? They initiate inflammatory cascade. You understand? They do not act directly on the brain's thermostat. So they are exogenous. But endogenous pyrogens, that's the messengers. When innate immune cells, most notably macrophages and neutrophils, encounter and phagocytize these exogenous invaders, they become very activated. So in response, they secrete cytokines inside the body. You understand? So the primary, the major endogenous pyrogens you need to know is interleukin 1, interleukin 6, TNF, that's tissue necrosis factor. But don't worry about it. I'm not going to go that deep, right? So, but you need to know endogenous pyrogen is produced by neutrophils and macrophages, all right? Not bacteria, not mast cells, not viruses, not plasma. Produced by neutrophils and what? Macrophages. Endogenous. Exogenous, we talk about bacteria, viruses. Endogenous are things that are not inside the body that came into the body to cause hot temperature. Exogenous are things inside the body that causes hot temperature. Chicken. So if they ask you this question in the exam, you eat it, chew it, bite it, and pour it out. And you know that a pyrogen is anything that causes fever. So this question. The first series of neutrophil behavior in inflammation. For inflammation to happen, what was the first thing that neutrophil does? Quickly. Chemotaxis, margination, diapedesis, phagocytosis, opsonization. Quickly now. Quickly, guys. Yes, the answer is imagination. You guys are so correct. The answer is imagination. The answer is imagination. Mm-hmm. The answer is imagination. Look at this giveaway question. I'm not supposed to be asking this particular question now. But let me just ask it as a giveaway. Just tell me A, B, C, D, or E. What's the answer to this? Dash is not a cardinal characteristic of inflammation. It's not. Dash is not. Quickly. Come on now. Impaired use. So this one is just it's a giveaway. I don't like all those kind of questions. It's too cheap. If they give you this one, you chew it. Look at this one, guys. Oh yeah, eat this one now. Let me see very fast. Let me see how fast you can eat questions. Look at this one, guys. Which of these cellular agents does not participate in inflammation? We have cytotoxic T cells, we have macrophage, we have eosinophil, we have neutrophils, we have endothelial cells. Which one does not participate? Does not participate in inflammation? Perfect. The answer is A. Why is it A? Cytotoxic T cells, that's CD8. They are highly specialized cells of adaptive immune system. They do not participate in non-specific or generalized cellular inflammation. No. You understand? Inflammation is non-specific, generalized, cellular, most times. All right. So things like neutrophils, macrophages, eosinophils, endothelial cells, all these are involved in what? In inflammation. But cytotoxic C cells is not. That's the CD8. It doesn't involve itself. All right. If they give you this question, you chew it. This question is too cheap. I don't like the cheapness of this question. Why is it that cheap? Look at this one. Guys, look at this particular question. Oh boy, let me reduce the fonts. A, B of the immune system. C, D. Answer. One characteristic of the immune response is specificity. This means that dash. Answer. Quickly. We don't have time for. Don't think. You don't need to think too much. Okay, think, please. You have to think. Quickly, guys. The answer is D. Immunity is directed against a particular what? Pathogen. That's the meaning of specificity. The answer is D, guys. Let me not waste too much time. Not E, D. The answer is D. E says what? Immunity is carried on by a specific group of tissues of the immune. Nah. It's talking about where it's directed. All right. So you have to read the questions very well. C says immunity is carried on by a specific group of cells. E says by a specific group of tissues. They are playing with you. You just look at it and you just laugh. You say, what is these people talking about? You just laugh at them and you pick your D and you move. I did not say you move. I say you move. All right. So look at this question. Cellular or cell-mediated immunity is effective against what? Allergens, venoms, cancer cells, extracellular viruses, toxins. Answer. Answer. Yes, cancer cells, specifically CD8. Cell mediated. It targets any mutated cell or cell that is growing abnormally. All right, that's cancer cells. Very important, you know that. So when you see cancer cells, you are thinking of what? Cellular. All right. Look at this. Vaccination stimulates which immunity? Which immunity does vaccination stimulate? Yes, the answer to that question is C. All right, you're correct. Which immunity? Natural active, artificial active, natural passive, artificial passive, innate. Quickly, guys. Quickly. Move it. Come on now. Immunity is artificial. I'm even saying the answer, Seth. Vaccination stimulates which immunity? Are you people going to watch soccer instead of concentrating on what we are doing here? What are they playing? So it's still 1-0. Messi has scored. Messi just scored. I'm so angry. So angry right now. How can the keeper cannot even catch that ball? Like, Jesus. I'm Real Madrid fan, so I don't like Barcelona. Okay, guys. Yes, the answer is artificial active. Yes, that's immune. Anytime you see any anything vaccination, it's artificial active. All right. Look at this one now, for example. Let me show you this answer. This question, for example. What's the answer to this one? Use the same options. What's the answer? When you serum used for emergency treatment of snake bite stimulates what? Immunity. Which immunity? Use the same option. No. Artificial for snake bites, those serum for snake bites are not vaccination against snake bites. It's serum to treat snake bites. You understand? So they are usually artificial passive. For snake. So they are usually artificial passive, but vaccination is artificial active. Please just remember it in your head. Vaccination activates artificial active, but that snake venom snake bite treatment is artificial passive. Don't let them confuse you. That's why I purposely ask those two questions, because any of them can come out. If you see snake bite, choose artificial passive. If you see vaccination, choose artificial active. Look at this question. A and dash is an example of is the region of an antigen that stimulates an immune response. Everybody knows this one. If anybody fails this question, I will chase you away from my class if you are in my class. I'm playing now. Don't mind me. So look at this one. Which one? Quickly. Which one is the region? Which And dash blank dash is the region of an antigen that stimulates an immune response. With the place I was telling you that has immunogenicity. Which part? Which one? Because I explained the immunogenicity area and I explained the one that is too small. Yes, the answer is A, epitope. The one that is too small to generate immune response is hapten. You understand? And major histocompatibility complex is the vehicle that carries the epitope. You understand? Look at this question. Now, immunoglobulin, and that's the last part of this discourse. Because I decided to add another 30 minutes. So I'm ending 10:30. Each immunoglobulin has dash antigen binding site 24613. How many binding sites? Quickly now, quickly. How many binding sites? What's happening? How many binding sites? Two binding sites, correct. You can't forget that. Look at this question. That constitutes about 80% of circulating antibodies in the plasma. Which antibody? Dash constitutes about 80% of circulating antibodies in plasma. IgD, IgE, IgA, IgM, IgG. Yes, the answer is IgG. The answer is IgG. You guys need to know. You understand? IgG is very, very important for you to know. All right. I'm gonna ask you others among them. Look at this one. The answer is IgG. Remember, I told you to study these things very well because there are a lot of questions like this. Look at this. Which class of immunoglobulin provides passive immunity to the newborn? Which one provides passive immunity to the newborn? Use the same option. Come on, guys. You guys are slowing me down. What was the question, sir? Which of class and immunity provides passive? Yes, it's IgA. Yes, that one is IgA. Yes, that one is IgA. It's IgA. Yes, IgA. A for newborn, eh? Look at this. The majority of, yes, that's C. The majority of the C cells of the naive lymphocyte pool wait for the encounter with a foreign antigen in the dash. Where do they wait for the enemy to come? Plasma, thymus, lymphoid tissue, lymph, and blood plasma. Plasma, thymus, lymphoid tissue, lymph, and blood plasma. Quickly. The majority of T cells of the naive lymphocyte pool wait for the encounter with foreign antigens in where? Lymphoid. So the answer is lymphoid tissue, all right? The answer is C, lymphoid tissue. This one is very giveaway. This one I've said it many times. No, not lymphoid tissue. The answer is C, not D. Not lymph. Lymph is just the fluid. So where they encounter is the lymphoid tissues, all right? Look at this question. Helper T cells that CD4 recognizes antigen when they are bound to an A or an dash. You remember what I mentioned this thing many times. I remember when I was describing using my cup, my beautiful cup, to describe. You understand? What was the answer? You see, the question came out in different formats. And now some people are finding it difficult because probably they were not listening. Somebody was rubbing their ear when we were talking about it. Huh? I'm blowing whistle inside their ear and telling them sweet things. So that's why they did not hear. I remember telling you, this guy that's CD4, CD8, they don't see these antigens. They are blind to them. So they have to be presented to them. So antigen presenting cells swallow these guys, break them into epitopes, put the epitopes on MHC. MHC carries it, and CD4, CD8 are able to recognize and say, oh, okay, and they will not attack. So the answer is MHC. It can be one or two. All right. The answer is major histocompatibility complex protein. Very important that you know that. And another thing you need to know is APC cells. All right. APC cells are dendritic cells, macrophages, B cells. That APC. Antibodies are not APC cells, antigen presenting cells. There's a question like that too. They say which of the I don't know if I should ask this question. I've already said the answer. Yes. Look at this one. Which of the following cannot act as APC, antigen presenting cell? Which one cannot act as APC, antigen presenting cell? So you need to know which ones are APC. Dendritic cells are APCs, macrophages are APCs, B cells can serve as APCs, but antibodies can never be APCs. Remember that. APCs is antigen presenting what cells? I have very few questions to leave you. Look at this. Cytotoxic T cells are like natural NK cells because they both dash. Oh, I need to give you options. But there is something about I said before about cytotoxic T cells and NK cells. If you remember, if you know, you know. If you know, you know. Answer. What do both of them have in common? This is something that if you fail, nobody will forgive you. What's the answer, guys? Yes, secrete granzymes and perforins. Yes, secrete granzymes and perforins. Look at this question. Look at this question, guys. What was the answer? Quickly. Memory T cells, regulatory T cells, help natural NK cells, helper T cells, and cytotoxic T cells. Quickly. Answer. Which one participates in both immunity, both innate and the immune response? Quickly, guys. You guys are taking long. Only 3 people. What is happening? I will stop. Oh, I will stop. What did I even ask? Dash participates in both innate. Which one? The answer is helper T cells. A, B, C, D. The answer is D. It's helper T cells. Helper T cells. You guys have to be fast now. I'm not almost done. But if you don't respond fast, I'll just stop. Memory T cells can be up to dash old. Weeks, days, decades, years, months. Quickly. Weeks, days, decades, years, months. Memory T cells. How many? How long do you have memory? Just think about yourself. Just years, so 2 years, 3 years. Decades. Decades is the answer. You understand? Not years. The answer is decade. This one is they just want you to use your common sense. Before B cells secrete antibodies, they differentiate into what? I've already given this question a long time. Before they become antibodies, what did they change into first before becoming antibodies? Answer. Come on now, you guys are slowing down, man. Michael is still in decades because he's watching Messi play football. Something that we've forgotten. Yes, the answer is plasma cells. The answer is plasma cells. IgE is produced by dash cells. IgE is produced by dash cells. Which cells produces IgE? Use the same option. The answer is plasma cells. Somebody said A, stem cells. No. Look at the question before this one. They said before B cells secrete antibodies, they differentiate into what? We said plasma. Means B cells become plasma, then plasma become antibodies. Antibodies are IgE, IgD, IgA. All those things are antibodies now. So here they are just being technical with you. They just say IgE. IgE is an antibody produced by what? Plasma cell. All right. So the answer is plasma. Don't worry. I just have very few questions to go. Analogic. Immunity, most common immunity, after immunity. I have just very few questions to go to leave you. I really don't like leaving stones unturned. Most common allergies are the results of what? Most common allergies. Most common allergies are the results of this autoimmune diseases, type 4 delayed hypersensitivity, type 3 delayed immune complex, type 2 hypersensitivity, then type 1 acute hypersensitivity. Answer. Which one is the most common? Autoimmune, type 4 delayed, type 3 hypersensitivity, that's immune complex, type 2 antibody dependent cytotoxic hypersensitivity, and type 1 acute. Which one? Yes, the answer is E, type 1. You see this diagram? Go and prepare for it. They will ask you which one is the largest lymphoid organ. You pick from the diagram. They'll ask you which one collects chyle. You know what chyle is? Guys, what's the answer to the question? Which one collects chyle? CHYL. Looking at that diagram, which one? Which one? Oh boy. Okay, then go and prepare for it. Also prepare for the tonsils. Tired. Prepare for the tonsils. They'll be asking you which of these is referred to as adenoids. Right? Which one is adenoid? Let me see. A, it should be adenoid, yeah. You understand? Which one is mostly infected in, most often infected? Which one? You pick it. Which one is most often infected? I think they will also ask you, let me see. Which one is referred to as palatine tonsil? Which one is the most often infected? Which one is referred to as palatine tonsil? You understand? So you go and prepare for it. Then look at this, guys. You also prepare for this one. They will tell you which letter represents a natural killer cell. Of course, you know that natural killer cell is A. That's one. Everybody knows that. They will ask you which letter represents a macrophage. Macrophage is the one that engulfs, so it's automatically E. Everybody knows that. They say, what chemical does B represent? Look at B. B is perforating, right? So it should be perforin. I'm even telling you guys the answer. Okay. Then you should prepare for this image. You should prepare for this image. Very important. All these images, you know, they'll ask you what is E. E is the dive. You see, E. Look at E here. I don't know if you can. Yeah, you can see my mouse. Let me see. Can you see my mouse? Can you see my mouse now? So this is E. E is disulfide bond, right? So you can't fail that if they ask you. They will also ask you which one is complement bind. Which one is complement bind? That is this F. I don't think it's labeled in your slide, but remember it. That's this F, complement bind. This is complement bind. All right. So you need to know disulfide bond and complement bind. Those are the two major questions they will ask you there. And also, which one represents constant regions? Constant regions. You should know which one is constant regions. You understand? That's this part and this part. C and D is constant regions. You understand the thing now? Then they may ask you, let me see, is there any other question they ask? Did they ask variable? Okay, constant regions, disulfide bond, and complement bind. Okay, so that should be it. So that is it, my people. Any question? This is marathon, 4 hours, 15 minutes. Any question? Just 2 topics. Imagine. Yes, of course. Use the same link. Yes, use the same link. Or if you just come to my channel, go to the live, click the live, you will see this video. All right. Or just use the same link. You know, it works. The last chapter, you read it on your own. Questions will come out from it as well. You read it on your own. You understand? Make sure you don't fail anything from this chapter and urinary, the 2 of them. Make sure you don't fail one question. Then the last chapter, read it on your own. Yes, ask your question. Ask your question. I'm listening. Are we getting the true or false in the exams? Or both of them? Both of them. Yeah. You're welcome. Please, are we getting true or false? Yes. Not here. I will think about how to do that. Okay, guys, you guys are the best. Thank you so much. I need to go off. I've tried now. I've tried. This is almost 4 hours, 17 minutes. Please click like. And if you are not subscribed, please make sure you subscribe to the channel. Make sure you subscribe and click the notification bell so that even after dealing with your class, I said dealing, after dealing with your class, that we, the microbiology, pathology, med surg, we can always do it online. All right, here and discuss some things. Or maybe you ask questions or you tell me some videos you want me to make. I will always make them. All right. So please try to subscribe. All right. Everybody, do it now and put this, click this thing. I'm seeing only 10. Click it. Okay, I'll see you guys later. And I'm going to, since there's nobody asking any question, I'm going to go off in the next 30 seconds. And I'll count, as I always do. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Good night, guys. Take care of yourself. Talk to you later. How do I even end this thing? Oh, Jesus. Okay, that's it. Yes, thank you. Thank you. Thank you. Good night. Don't forget to subscribe and click like. Don't forget to subscribe and click like. And also click the notification bell so that you'll be informed. All right. Always click this like. Extremely important to me. All right. See you later. Bye-bye. I'm ending the stream now. Bye.